this hearing of the Senate Select Committee on Measuring Outcomes for First Nations Communities. I begin by acknowledging the Gadigal people of the Eora Nation, the traditional custodians of this land, and pay my respects to both elders past and present. I extend that respect to all Aboriginal and Torres Strait Islander people here today. We will be conducting today's hearing in person, and I am joined by the Deputy Chair, Senator Stewart, and committee members, Senator Namajimpa Price and Senator Little, not Cadell. This is the first public hearing of this important inquiry, which requires the committee to consider the regression of several closing the gap targets, including the rates of suicide, the number of children in out-of-home care, adult incarceration, and the number of children commencing school who are developmentally on track. On behalf of the committee, I acknowledge that this inquiry and the matters that we are about to discuss might cause distress to people giving evidence or listening to the hearing. If you need support, we encourage you to contact Lifeline on 131114 or 113 Yarn on 139276. With that said, these are public proceedings being audio streamed live, and a Hansard script is being made. I remind all witnesses that giving evidence to the committee that they are protected by parliamentary privilege. It is unlawful for anyone to threaten or disadvantage a witness on account of evidence given to the committee. Such action may be treated by the Senate as contempt. It is also contempt to give false or misleading evidence. Witnesses also have the right to request to be heard in camera. If a witness objects to answering a question, they should state the grounds upon which the objection is made, and the committee will determine whether it will insist on an answer, having regard to the grounds which is claimed. If the committee determines to insist on an answer, a witness may request that the answer be given in camera. Could I please remind those contributing to that they cannot divulge confidential, personal or identifying information when you speak. If you wish to supplement evidence with a written information, please forward it to the Secretariat after this hearing. The committee has resolved that answers to any questions taken on notice should be provided to the Secretariat by Wednesday the 5th of March 2025. Before I begin, I would ask everyone to ensure that they've switched off or turned their mobile phones to silent. I now welcome Commissioner Selwyn Button and Assistant Commissioner Sarah Leary from the Productivity Commission. I understand that information on parliamentary privilege and the protection witnesses giving evidence to the Senate committees has been provided to you. For the Hansard record, will each of you please state your full name and the capacity in which you appear today?
Thank you, Chair. Selwyn Button, Commissioner from the Productivity Commission.
Sarah Leary, Assistant Commissioner at the Productivity Commission.
Great. I now invite you to make a brief opening statement before I invite members of the committee to ask questions.
Thanks, Chair. And can I also start by acknowledging traditional owners on the land that we're gathering today and pay respects to their ancestry in this country. As the Productivity Commission's role in relation to the reviewing of the National Close the Gap Agreement is outlined in Section 9 of the agreement. It details two functions for the Productivity Commission to undertake as part of the implementation of the agreement. The first one is to develop and maintain a public dashboard. So that's about reporting on progress. So on our website, we have the Closing the Gap information repository, which outlines the targets and shows progress against those targets at both a national level as well as jurisdiction, and also goes into geographical remoteness across the country. So we maintain that, and we collect information from government agencies across the country to input the data into that dashboard. The dashboard, just for information of the committee, the dashboard is actually the most visited website on the Productivity Commission's webpage. So it's very, very popular. Lots of people want to know about progress and how things are progressing. The second part of our role that's in Section 9 of the agreement is in relation to the review, and we every 3 years we are required to undertake a comprehensive review of progress. And that is having conversations with community as well as governments right across the country to get an understanding of how things are going in terms of implementation of the agreement to then report back. And our last report, we've done one review since the implementation of the agreement, and the last review report was released in February last year. And again, it's one of those pages on our website that's frequently visited for people to get an understanding of exactly what progress looks like. In addition to those roles, we also undertake further research into relevant policy priority areas identified through the review, and updating information on the dashboard. So the information on the dashboard is updated in a timely manner when data comes to us via sources such as ABS and a whole range of Department of Education, etc. When those come through at different intervals, that's when we update the information on the dashboard. So the agreement itself includes a performance measurement framework with targets and supporting indicators and data development items. Not all targets actually have data sources for them at this point, so there is some work that's actually happening to look at data development in relation to a couple of those things. All of those decisions are undertaken, and the work that's undertaken through the partnership working group. So that's the main body that's established in terms of the governance arrangements around the partnership agreement. And it's endorsed by Joint Council, which is obviously then the coalition of peaks and first ministers across the country. So there is a data and reporting working group that's pulled together to start to look at the data development that's necessary, and the productivity. We work directly with the data working group to keep them informed about progress and where we're seeing data gaps, etc. So we can look at updating information on the website as well, and actually work directly with the data custodians to look at different methodologies of collation and ensure that we've got valid sources, etc. So the terms of reference for the inquiry that this committee is undertaking sit very much in the realms of the recommendations that came out of the report in February last year, which is very much about focusing on data development and making sure that there are not only supporting indicators, but we actually do have some consistent collection of data across the country that focuses on what's necessary to demonstrate improvement. So what I might do is to pause there to allow the committee to go to questions as opposed to continuing anyway. Yeah. Chair?
That's great. Thank you very much for that. Senator Stewart, I think we'll go to you first.
Thank you, Chair. Thank you very much for appearing before the committee today. You mentioned that there are some targets which we don't have any ability to measure them. Can you tell us why that is? Is that a recent thing, or has this persisted for a while? I suppose I'm just wondering kind of how we've gotten to this point.
No, so some of those targets that don't have a consistent measure is purely because there isn't a consistent definition and a consistent way of collecting nationally.
Yeah, okay.
Because we aggregate the information nationally, if jurisdictions are doing things differently in relation to how they're measuring and monitoring and the data definitions that are wrapped around each individual target, then it's a little bit hard for us to look at the aggregation to report nationally because of the differing definitions and the way that they're doing things as well.
Yeah, and so those can you just tell me what those targets are?
So one of those is around family violence, because there isn't a consistent collection or definition of family violence across the country. The other one there's some work that's happening on at the moment is around community infrastructure, and that's looking at water and a whole range of things that go into communities, even though that we do have some work that's happening federally around what that looks like. And the other one is in relation to data and digital in access to internet and those sorts of things as well. Yeah. Because we don't have consistent ways of collecting those things. That's why those things don't appear on the dashboard at the moment.
Okay.
Well, they appear on the dashboard. There's no numbers attached to them.
Okay. And so, in relation to family violence in particular, and I'm going to kind of go to each of these.
Yeah.
Is there any jurisdiction that you think is doing that well that should be adopted nationally?
It's tough.
I know you don't want to play favourites, but I'm asking you to play favourites.
No, Senator, it's a good question. I guess for us, the difficulty is really about how do you aggregate. And if I use another example that might be a little bit better to then think about, is when you can get jurisdictions, at least a small number of jurisdictions, or at least half the jurisdictions, focusing on shifting towards a single collection methodology or some consistency in the collection methodology, it becomes a little bit easier. So one of those ones that was reported on that was only a couple of jurisdictions contributing to it was suicide rates. So we now have more jurisdictions that have shifted the way that they collect the data, so that we're getting more of them report on suicide rates in community at a more consistent level.
Yeah.
and I'm not saying that one just because it was Victoria that has come around to then start contributing the data, but
Yeah.
Victoria was collecting it differently, and
Yeah.
the methodology in Victoria was different to some of the other states. So it was about making sure that where it was being collected, where it was being collated, was then similar to others. So at least we can pull all those together and have an aggregate, a true aggregate reflection of what was happening.
Yeah, and who, I suppose, kind of led or influenced those conversations to get Victoria to, I suppose, kind of shift how they were doing things so we could capture it?
And
Did you lead those, as in, did the Productivity Commission lead those conversations?
Yes, so we've been in conversations with the Victorian Government about that, but it's also been through the data working group, because Victorian Government have been a part of that process as well.
Yeah.
So it's been a process of negotiations along the way to at least make sure that people start to shift towards consistency.
Yeah.
If you think then about things like family violence, it's also then for us, because we're not the data custodian, where we do the collation and the analysis and put it on the public website. It's then working with the agencies who are doing the collection in the first instance, like the ABSs and others, to then work out, okay, well, how do we make sure we can get some consistency from agencies?
Yeah. And who collects the most useful data for you?
A lot of the information that comes on our website comes from the ABS.
Okay, so the ABS collects the most useful data, but particularly in relation to family violence, though.
For family violence, because it's recorded differently, that would come from jurisdictions, not necessarily from the ABS.
Yeah, but who's doing it in the best way?
That's a good question, Senator. I wouldn't be able to say who's doing it better than others. I guess it's the definition stuff that we've got to get right first.
Okay, all right. And there's a similar challenge for community infrastructure.
It is, and there's some work happening at a federal level around community infrastructure as well, because there are some things that that federal agencies are responsible for in terms of direct community infrastructure that we think there may be a better way of collecting that at a national level as opposed to looking at the jurisdiction. So there is some work that's happening about some national definitions on community infrastructure that's happening now that hopefully will inform what jurisdictions are doing as well.
I can add to that, Commissioner, if possible. We have been observing some of the Department of Infrastructure's efforts under Target 9B. What's impressed us is that they're also embedding the priority reforms into how they do that work. So while the data development work is still in development, we have observed some genuine observations of transformation in that department.
Great.
And there's strong leadership there taking that work forward.
Yeah. So they're not just hell-bent on delivering the outcome, it's about how they're working too, which is making the difference.
Yeah.
Yeah, great. Okay. And final question on this particular thing before I move on to another topic. What are the, I suppose, kind of challenges or issues of not having a consistent, like, measuring or definition or whatever? Like, what are the risks in that for us?
Yeah. Look, two things in that, Senator. One is, if you don't get consistent data definitions and get consistency around aggregate collection, there's no way of looking at national reporting, so, which is why some of those targets that we've got on the dashboard don't have a figure against them, because we can't national report. When you're not national reporting, the information is not publicly available to then display.
On a national
progress.
level.
On a
So
national-
each of the jurisdictions are measuring those things, but we just don't have it in a consistent way.
It's not consistently aggregate up to the national reporting. What that also does is then looks at a jurisdictional level. If the jurisdictions aren't contributing to a national aggregate, we're then not able to look at the jurisdictional breakdown, because we do jurisdictional breakdowns on our website as well in terms of progress against the targets for jurisdictions. So if we're not getting that information, we can't give more detailed information about how jurisdictions are going. So that's one part about the reporting itself. I guess the second part of it is that where there are data gaps is in relation to the implementation of the priority reforms.
Yes.
So the 4 priority reforms don't have any consistent way of collecting information to show progress against those priority reforms, and those priority reforms are essentially the pillars for the implementation of the rest of the work that needs to happen in the national agreement. And one of the key recommendations that came out of our report last year was to say we need to be collecting data on the priority reforms, because if we don't know that things like transformation inside government agencies is occurring, then we don't know that there's a flow-on effect to improving outcomes.
Okay. Now, on the kind of topic of improving outcomes, there are 4 closing the gap targets that are going backwards.
Yeah.
Can you remind the committee what those are?
So the four targets that are regressing, we have incarceration rates, child protection rates, it's suicide rates, and the vulnerability of Indigenous children. So the Australian Early Development Census indicators of vulnerability, they're the ones that are going backwards.
Okay. And can you tell us why?
At this point, we wouldn't be able to explain exactly why. I mean, there's a number of reasons why, and I guess for us, it's really about how do you put the focus on the transformation inside agencies and certainly what needs to happen in community that starts to look at a shift. The work that we do and how we contribute to that is really about the supporting indicator work that happens on our website as well. So what we do is unpack the data itself to determine what are some of the lead and lag indicators that go into the targets themselves. So if we look at incarceration rates as an example, one of the things that we collect from jurisdictions on a more regular basis, which is a good indicator of knowing what incarceration rates are going to look like, is interactions with police. And where we are seeing, where you can see that interactions with police are increasing, then there is a direct correlation to looking at increasing incarceration rates. And so our job is to describe those things so that you can understand what are lead and lag indicators to get to the outcome, and start to then unpack what's the work that needs to happen by jurisdiction to then focus on, I guess, improving those things, which ultimately will improve the overall target of the future.
And so do you then have those conversations with jurisdictions about here are the things that we know are causal for higher incarceration rates, contact with police?
Yeah.
We suggest that you look at programs that go to reducing the contact with police.
Yeah. So that's part of our work, is then the interactions we have with jurisdictions, not just through the governance arrangements, but outside that separately in terms of, I guess, the relationships that we have as the PC. We have those conversations with jurisdictions to then talk about the things that we're seeing in the data that we think will make a difference to improve outcomes.
And are there, is any of these four targets doing better than others as per jurisdiction?
By jurisdiction?
Yeah, like when you can compare them, is there a jurisdiction that's kind of faring better than others?
Yeah, and it depends on the data set. If I use the incarceration rates as a good one, certainly the Northern Territory isn't going that well.
Yeah.
And you can see that there's a slip, and certainly what we will see, and there's a change to the population estimates that'll happen on our website, because it's based on the 2021 census. Those things will change on the website from March, and what we are seeing is that there will be another dip in what it looks like in terms of incarceration rates. So more people are incarcerated against the broader population of the Northern Territory in particular.
Yeah. And are you able to look at particular jurisdictions and point to particular programs that are working to like divert people from the does your kind of work go that kind of deep into what it is that states are specifically doing? Yeah.
So, and certainly one of the ones, if you think about some of those that are exceeding, so it's a good question, Senator, because you think about the exceeding targets and things like healthy birth weights is a great example. We've spotlighted in the review and talked about on many occasions the birthing in our community programs. And certainly the work that's happening in the south coast of New South Wales, at Waminda, where there are birthing on country services, and where we're seeing intensive effort around community-led and community design programs that government's investing in. We are seeing an increase in those things. So healthy birth weights absolutely is, you can see a direct correlation to activity.
Yeah, okay, great. I'm just checking in on time.
Yeah, one more.
One more, great. On a again a kind of different road. So one of the kind of most overwhelming things that I hear about the closing the gap targets in particular is that they're so deficit focused, and that it often then dominates the kind of national narrative about who we are as a people. I suppose I wanted to get your kind of views on, I suppose the challenges with only measuring deficit about who we are, and what are the things we might be able to do to change that.
To shift some of that, and it's a good question, Senator, and it is some of that I guess, internal-led research that we undertake at the Commission, is working out where are things working well, what can we then highlight or spotlight, do a further deep dive into, then explains to the public, the general public, etc., around exactly what's going on. So it shows it in a positive light. Birthing in our communities was one of those things that we spotlighted in our report. So it's about how do we bring those stories to the fore that says communities are getting together, they're having conversations, and they're working with government to co-design programs, and they're improving outcomes. So it's picking those things. And another one, I guess, one of those things that we're focusing on ourselves is looking at things like the target in relation to native title. So land and sea rights is one of the targets that sits in the agreement. It's a target that's exceeding because Aboriginal and Torres Strait people's access to land and sea rights based on native title determination, etc. That's progressing well. Yeah. But what we're not seeing is then the flow and benefits in relation to saying, well, if we're doing that well, what's the benefits to community? Yeah. So how do we then get a better understanding of knowing what's the direct correlation between native title rights and then community benefit? Yeah. And are we actually improving those circumstances too?
And is it leading to better economic outcomes for not just kind of the health and wellbeing stuff? Yeah. Yeah.
And Commissioner, I think there's a really important element of our work that's around telling the story behind the data. Yeah. Although the targets and indicators are set by the partnership working group and we respond to that authority, there are things that we as an organisation do on the dashboard to provide historical and ongoing context that does tell the broader story behind some of those targets that are either improving, worsening or no change. Yeah. So I think that to date we've published 6 historical and ongoing context pieces on our dashboard, and that scale and spectrum of work is expanding at the moment. Yeah.
And it's about the practical. It's a good point because it's about the practical, I guess, application of what we can see, Senator. And, you know, the AEDC, so the vulnerability index for kids is a good example because the survey's done in the first year of schooling for all children, and we do know that the lowest scores in that entire survey for Indigenous kids is in relation to being read to at home and having access to books in the home. And so we know that Indigenous kids are going to start on the back foot because those things are vulnerabilities in the first instance. So it's about actually spotlighting that and highlighting what those things are because it can actually then change what
it sounds like it's a very practical response to that.
Very practical.
Yeah. So I do need to share the call. I'm getting the side eye here from the chair.
Thank you, Senator Stewart. Senator Namadjib-Price.
Thank you, and thank you for being here this morning. I just going on what you last talked about in terms of land and sea rights and the situation for traditional owners. Have you seen any progress in terms of improved economic conditions or lives of those who have had access to their land once more and sea as a result of that? What does the situation look like?
Yeah, look, it's not. There isn't. We're not seeing economic empowerment across the board, Senator. But we do know, in terms of the research we've started to undertake, is that there are some barriers to progress around economic empowerment. And for us at the PC, I mean, not only are we a research institute, our focus is on economic productivity of the country as well. So it's about how do we focus on those barriers to shift them to become enablers for economic empowerment for Aboriginal and Torres Strait people. Certainly a good example of that, and I talk at length to my team about this, given the work I've done in the past. A good example of that is the restrictive nature of native title trusts that exist across the country, which don't allow for economic empowerment in communities. So there's restrictive natures of the way that native title trusts have been established in the country, and it's about how do we actually look at a new way of doing things that better support than what's going on and better support community aspirations to look at economic empowerment for traditional owners.
So with the situation, would you suggest that since, I guess, the progress toward land and sea rights, would the situation have got worse or remain the same, or just in general terms?
Look, what we have seen, certainly in the data, is, as we're saying, we're exceeding the target, so we're on track to meet the target by 2031 that's been set in relation to land and sea rights. So there's been a significant piece of work that's happened through the court system around native title claims and land handbacks through state and territory governments as well. So that part in the data is telling us that things are working well. It's the next iteration of that, as we mentioned. What's the flow-on benefit that goes back to community as a result of those things occurring? And that's the piece we're not seeing at the moment, is the flow-on benefit that goes back to community as a result of I guess, achieving native title or receiving land handbacks, etc.
Yeah. You talked about inefficiencies in terms of collecting data. Is there any particular process in terms of data delivery and collection? Are there deadlines for those entities that are to provide the data to the work that you're doing, or is it just sort of an ad hoc situation?
There is this work happening around a data development plan, and there's certainly some work that's happening within the space of the partnership working group to look at identifying who is best to lead that work. Because at the moment, what's happening is that we're coming together through the data reporting working group. There's work that's been occurring on the data development plan, but there's no natural lead. And that's been the difficulty within the federal space, is having a natural lead that says, okay, I'm going to take charge of this and I'm going to drive it and work with partners to make sure at least we can start to improve things and to focus on those KPIs and timeframes as well.
So there's an indicator in the report of the proportion of females aged 15 years and over who experience domestic and physical or threatened physical harm in the last 12 months, but the latest data suggests that it's from 2018-19. That's 6 years out of date. So is there a reason for the delay in that data, the more up-to-date data?
Yeah, and that's, Senator, that's certainly one of the ones we were referring to earlier, where because there's no consistency in the definition and the way that data's collected nationally. That is the one that becomes difficult, because the last time it was collected nationally at a consistent level was what's being reported on the website now. Now that's part of the data development work that needs to happen, to then be able to say to jurisdictions, if we're going to get this right in terms of having a national collection of data that reports on this indicator, we've got to make sure that we've got consistent definitions occurring.
And you suggested, in terms of those targets that are regressing, but you couldn't explain why those targets were regressing. Is there a way to determine why? Or is there going to be, I guess, an initiative to understand why those targets are regressing?
Yes. Yeah. Quick answer for you, Senator. Yes, there is, and it's really about, as we said, taking a bit of a deep dive into some of them, and that's one of the plans for us this year, particularly around the ADC, the vulnerability index, is to have a bit of a deep dive into that, so at least we can identify what are those vulnerabilities, what are the questions that Indigenous families are scoring lowest, and what's the practical steps that we think should be taken through mums and bubs programs and in childcare centres prior to the first year of schooling when the survey's done. What's the stuff that happens in the lead up to that can actually influence the outcome of the vulnerability index?
I guess not being able to understand why those targets are regressing doesn't, I guess, put us in a place where we can determine what can improve those circumstances, or provide recommendations, if you like, if we can't understand the regression in the first place. One concern that I have is, and this is probably across the board, is the fact that we do have an incredible uptick in individuals now claiming indigeneity in Australia. Do you regard this as a concern in terms of the way that we do collect data for the benefit of closing the gap, the report?
Look, we don't have a view on whether or not it's a good or a bad thing. I guess it's really that we do know in the ABS collection process and come out of the 2021 census, there was a significant increase in the population that self-identifies. Because, sorry, 25%.
It's got to make a difference to the data, surely.
what it's done to the data, and there are actually there are 4 of our targets that are population based. So we use the population as a denominator, and one of those is incarceration rates. And so we have seen a shift in what the data looks like for incarceration rates based upon the new population estimate that's come out, and using that as the denominator to determine what incarceration rates are by jurisdiction. As I mentioned earlier, the one that's predominantly across most jurisdictions, what it's done is a reduction in the incarceration rates, a small reduction. The only jurisdiction where it hasn't seen a small reduction is in the Northern Territory. And that's because in the Northern Territory, the overall population base has actually decreased in terms of the estimate.
Final question, Senator.
That's a very interesting piece of detail to understand that it has decreased in the Northern Territory. Is there any plan to perhaps understand better the circumstances surrounding indigeneity for starters, but also the correlation between that and marginalisation, as opposed to collecting data across the board in terms of all Indigenous Australians? Is it considered in any way? We talk about the positive stories, those success stories. Is there any sort of, what am I trying to say? Is there any aim to really drill down to understand who particularly requires most focus in terms of our most marginalised amongst those that claim indigeneity?
Yeah, and it's a good question, Senator, because what we still do on the website and what will still happen post-March when the population estimates are updated is still report by jurisdiction and jurisdiction by geographic. And there is already a direct correlation in the data that we see in terms of those in remote and very remote that are suffering the most in the sense of what that looks like against the target. So when you think about a marginalised population, all the data on the dashboard still tells us that Aboriginal and Torres Strait people in remote communities are still the ones that are well behind in terms of achievement of the targets. So the data is still telling us that.
Okay, thank you.
Thank you. I will jump in. Has there been a formal response from Joint Council from your last report?
No, there hasn't.
There hasn't. So as per the agreement, it's to be responded within 6 months, is that correct?
Ordinary, if I take the approach, and it's a good question, Chair, normal reports come from the Productivity Commission are then provided back to the Treasurer, who obviously commissions us to undertake the work that we're doing. There's majority of those reports are going back to the federal government because they're about federal government initiatives. This one's a little bit different because it's about every jurisdiction. So it in terms of the response, a collective response to then the initiatives themselves, becomes a little bit more difficult to try and negotiate an overall response from Joint Council, because you're saying it's the federal government as well as the state and territory jurisdictions. What we have seen though is that the jurisdictions developing their own responses in relation to what's the recommendations in the review itself. Whether or not all of those are public, I don't think all of them are public, but certainly in conversations we've had with the federal government as well as with other jurisdictions, they are developing responses to the recommendations.
Okay. But there's no time frame, Commissioner, that's attached to that?
There wasn't a time frame, but certainly the Joint Council had accepted all the recommendations of the report, and certainly the one that was I guess a bit of a sticky one that was put on the not on the back burner, but in the space of looking at further development, was the establishment of the Bureau of Indigenous Data.
Okay, that's the one I was going to ask you about, funnily enough. Are we seeing much progress on that, the importance of having an Indigenous Bureau of Data?
Yeah.
Are you able to tell us what that progress looks like?
Yeah, and certainly from our understanding internally, we're not directly involved in all of the conversations about this, but it is part of the conversations that are happening in the federal government space, particularly around looking at the data development work that's necessary, and then how best to respond to what the Bureau of Indigenous Data and the functions and the role of that looks like in the future as well.
So in your January 2024 report, that was recommendation 2. Has that been recommended in previous reports, or?
This was the first one.
Okay,
Yeah.
that we've recommended
Yeah.
an Indigenous Bureau, and that's obviously because there's a range of data gaps, I'm assuming. Are there any independent mechanisms that are set up in states and territories for any of the closing the gap targets?
Not at the moment.
So not across any of the jurisdictions do we not have an independent mechanism?
Not currently. There is work being undertaken in New South Wales at this moment, and I understand the New South Wales government is partnering very closely with a New South Wales CAPO to develop a model, but I'm not yet across other jurisdictions on how to track it.
Yeah, so none that are actually established.
Okay. I'm curious then to understand how we're measuring outcomes at the state and territory level if there's not an independent mechanism. Do you have any insight into that?
And look, at most of the work, as Sarah alluded to, most of the work, Chair, is very much about negotiations that are happening locally. But the New South Wales government here is working with the coalition, the New South Wales Coalition of Peaks counterpart, to then work out what that looks like. I know that there was a joint report that New South Wales government funded to develop essentially what is an independent mechanism model. So that was published late last year. So there's work that's been done on what a model should look like in New South Wales that hasn't progressed to actually coming to fruition yet. But in the absence of that, we do know that there's regular governance meetings that are happening between community control and governments across the country to then determine, okay, well, how are we going against progress? The role of the independent mechanism, though, is separate to that, is different, because it's actually about measuring the overall performance and public reporting on the overall performance of all players in relation to the implementation of the agreement. And that's the piece that's missing at the moment.
Yeah. So is there public reporting in every jurisdiction? That's the question.
Only the reporting that comes to us,
Right.
that goes on our website, is the public reporting that's happening.
So there's no independent reporting that any state and territory jurisdiction then does that as tabling a report in Parliament, for instance, or talking about their overall performance against the closing the gap targets.
There are implementation plans. I'm not sure exactly how many jurisdictions provide, but there are implementation plans that sit on the Close the Gap website, which is managed by NIAA, National Indigenous Australians Agency, not with us. And we have been having some conversations with NIAA about whether or not, because the data sits with us, should the implementation plans, so that when people are going to have a look at what's happening in terms of progress, should they also be able to click the link to then have a look at a plan as well to see what jurisdictions are doing.
So this leads on to my next question. We've been in this process. Successive governments have been in charge of this process for going on 5 years now, and yet we still don't have any data on our national priority reforms. Is there any reason that's been given to the Productivity Commission around why?
And again, this comes back to the data. So, Chair, the difficulty is around the data definitions. And if I give a good example of where we know, so we do know that activity is actually happening inside agencies. And when we have conversations with agencies, we know that they're developing their own PR3 strategy, if you like. So Priority Reform 3, they're focusing on developing a transformation strategy internally. So we know work's happening. Again, it's that mechanism being able to aggregate that work to determine, well, what's the change that you want to see and how are you actually then reporting on the change to know you're making a difference in terms of transformation inside each agency. That's what we're not seeing in terms of the consistency, but we do know that activity is actually occurring inside agencies to look at undertaking a process of transformation.
Okay. Do we think that, and this may be to both of you, but is there enough in the toolkit for our NIAA and those, absolutely implementing these targets is there enough to guide that progress and enough of a foundation being laid to ensure that the measurement is trackable and is sustainable so that we can see what progress looks like?
Yeah, and a good question, Chair. I think there does need to be something that provides some consistent oversight to all the pieces of work. So, again, knowing that you've got agencies that are focusing on transformation and doing things that are relevant to their agencies and relevant to the work that they're doing and the relationships they have with mob across the country, there does need to be some type of oversight framework that looks at how do we cascade all of these things into a single piece that we can actually start to see some consistent measures on. We don't have that yet, but I think it is an important piece of the puzzle that's required to say from not just at a federal level but also at a jurisdictional level, what's the overarching, I guess, framework look like that you're monitoring performance on across all of the departments that are focusing on their targets around Close the Gap.
And Senator, as a research organisation, we do see an opportunity for the Productivity Commission to be plugging some of those gaps with knowledge products and practical guidance for departments on the how. One of the risks with the priority reforms, as they currently are stated, is that it allows a lot of room for interpretation by government agencies and departments. Since our review was released last year, there has been a real uptick in focus and emphasis from agencies and departments nationally on cultural capability training. But when we look at Priority Reform 3, it's about transformation. That goes to the heart of how processes are undertaken, how timelines are administered by officials, the whole picture rather than just pockets. So I think our team at the Commission is spending a lot of time this year in developing some of those practical guidance notes on the how, and we do know that the APSC and NIAA are doing that work as well.
That's great, thank you. I'll share the call to Senator Little.
Thank you. My question goes more to why and how you exist in this ecosystem. Whose report is this? It's Closing the Gap report that we heard about.
NIAA's.
It's NIAA's report,
Yeah.
presented to Parliament.
Yeah.
So when you do your Productivity Commission report, are you just relying on this, or you got a completely different set of data that you're using to make your assessment?
So we use the same data. So the data's based upon the targets that exist on our Close the Gap dashboard. So all the targets that are reported on in that report, Senator Little, are the same ones that we report on publicly. But the information that we gather in terms of that goes into our report, the review report that was released last year, came from consultations right across the country.
So this report, you would agree with me that data consistency, integrity, and accuracy is pretty important, and continuity in the way it's presented.
Yep.
Have you had a chance to look at this Close the Gap report compared to the previous year?
Yes.
What would you say about it?
For me, I think what we need to be able to do is
what would you say about the difference in the report if you've had a look at it? That's what I'm asking.
look, the difference is that there are more positive stories that are written in that report. Would be the first take on it. It is a shift away from where it was in the past, and I think because of the fact that we actually have the role of managing the dashboard, which is why there's a shift away from reporting on specific indicators, because that sits with us.
Well, I put to you, it reads like a promotional public report rather than consistently being able to make any comparison between the year before and this year's. I can't see in this entire report how it is you can tell which targets have moved in what direction. You tell me where they appear in here, because I can't find them.
And one would, I'm making an assumption here, Senator, but because of the fact that we actually collect and collate the data on our dashboard, is probably been a reason why many of the agencies have shifted away from looking at the collective reporting, because it sits on the Productivity Commission dashboard. So you can actually go in and just show progress. You can look at individual indicators to look at progress year on year.
But this is the one that's reported in Parliament.
Yeah.
That most of the public go to. They don't go to the Productivity Commission report. So, as a person interested in statistics and evidence, how is it possible to compare the evidence of the previous report compared to this one when most of it is filled with fluffy, positive stories? And I take the Senator's point about needing to have some positive stories in here. But the evidence is the evidence, is that not right?
Yes, but I can't comment on the development of the report because we're not involved in that report. All I can say, Senator, is that we report on the data and we have the dashboard which shows progress against the indicators.
And you have a lag. And you have a lag too. When will you report again on this report?
So the updating of the data happens on a more frequent basis. So dependent upon when the indicator itself, the target itself, there's a different collection methodology for many of the targets, but we will update that annually to show annual progress.
Annually you'll report on this. So we'll see a report on this 12 months from this or 12 months from your last report?
So there's a difference between the fullness of the report and the comprehensive review we've undertaken.
Right.
So the reporting annually, which is updating the data that sits on the dashboard, and we actually produce an annual data compilation report that goes with that.
Okay. I want to talk about your comments in the last Productivity Commission report that talked about the beware of the aggregate. Right. So in actual fact, this report tells us nothing about the devastation in some of the communities across Australia that has occurred because of policy actions of the government. I want to understand, where is the disaggregated data? Surely, if we can come up with figures that tell us about the aggregate, they can tell us just how bad the data is in some of those communities of particular interest for us. Where is it?
And the aggregate that we actually have it on our dashboard. So you can go onto the dashboard and disaggregate from a national level down to jurisdiction, and then by jurisdiction in terms of geographical area as well.
With respect, that's kind of like a full-time job, sifting through data to find out whether in fact things have actually improved or not. If you were a journalist, if you were one of us, if you were just, you know, a local wanting to understand what's happening in your town, it's a bit of a mosaic.
Look, it isn't an easy one, Senator, and I agree, it does take a bit of time. And that was certainly why the recommendation, the report last year about the establishment of the Bureau of Indigenous Data, one of their functions was to be able to do that for communities on a regular basis.
So I want to go back to the question that was asked earlier about the increasing number of people who are recently identifying as Aboriginal and Torres Strait Islander people, and the skewing of the data as a consequence. We're talking about a quarter of the people from one census to the next. And you mentioned that there's been some improvement in some of those indicators in New South Wales, probably Queensland, where the highest proportion is the number of people who have actually recently identified. That must be of grave concern when the data indicators in some of those places where the Indigenous population per proportion of population is much higher. It must skew the data. It must make this data almost redundant in some places when data is supposed to be accurate.
So and it's a good question, Senator. There are 4 indicators or 4 targets that are impacted by the change in the population. So that's adult imprisonment rates, youth detention, out-of-home care and suicide rates. So they all rely on the denominator of the ABS census. And so when that change occurs on the website come March, you'll see a shift. And as I mentioned, the majority of those will shift at an aggregate level. All 4 will shift down, so there'll be a small reduction. But at a jurisdiction level, there'll be some different changes. And as I mentioned earlier with Senator Namatjimpa-Price, there will be a shift in the Northern Territory because the population estimate for the Northern Territory overall is reduced, that you'll see a further spike in the incarceration rates. It's going the opposite way.
So what happens in a place like South Australia where there was an evaluation of the consequences, which were devastating for the Ceduna community and that surrounds us when the cashless debit card was withdrawn, but the state refused to provide any data, nothing on gambling, nothing on alcohol consumption, nothing on hospitalisation rates, nothing on children in out-of-home care, nothing on children who weren't in school. How do you get the data if a Commonwealth funded research institute, like research piece of work, can't even get the data from the states to inform what's actually happening?
So one of the oldest reports that comes out of, Productivity Commission's done a whole range of reports, as you know, for whole of government. One of those, which is a long-standing report that we've done, is the report on government services. and it's actually within the remit of the Productivity Commission to collect data from all states and territories, and has been for a number of years. Hospitalisation rates and some of those things you talk about, Senator, are part of that data exchange that is a given in respect of state and territory governments giving information to the Productivity Commission so we can provide that reporting. The ROGS report is one of the ones that we've been doing for years.
So would it be fair to say that there should be no issues whatsoever with data in any of those reports that you rely on in relation to health, because every time you go into a medical appointment you're asked your date of birth, what your name is, do you identify? So that data, because they collect it and there's a regulatory requirement to collect it, is there. So that data would be accurate, yes?
So that the data that's held locally would be accurate. Where there are issues, and this was one of the reasons why we were suggesting the establishment of Bureau of Indigenous Data. What we see at the moment is that all of the data that sits on the dashboard and all the data that you're referring to, it's in that report, comes from government sources. So it's all government data. What we don't see is recognition and validity of community control data. So data that sits inside an Aboriginal Medical Service that then starts to look at the overlay between the population data to then determine, okay, what does real improvement look like? And that was why there was the recommendations for the Bureau of Indigenous Data, because then you'd actually have a single repository that collects both government data and community data to give you a real picture of exactly what's going on in community, as opposed to saying we're just going to rely on government data to then determine what the story is. We actually need to respect the fact that community control services, as you know, Senator, have been collecting data from mob for many years, and there's a richness of the source of data that sits inside services. We've now got to make sure at least those things are aligning to then present the true picture of what's going on.
Okay, now let's talk about the opposite, where there's no data on domestic and family violence. Now, the reason given is because somebody thought it was too sensitive to collect the data, and they didn't have a culturally sensitive way to collect the data. The sector, people in the sector who have been around for decades and decades have even come out and been critical of that thinking. How do we actually make sure that people who aren't comfortable having uncomfortable conversations actually provide the truth, rather than hiding behind arguments that even their own sector, our own people, don't agree with and dispute?
And much of that conversation is part of the work that's happening with the data development work that goes on inside government, to then work out, well, what do we need to do to do things better? And again, if you're looking at data that sits inside community control services, you've got Aboriginal legal services, you've got women's legal services across the country that are collecting information, but again, it's not seen as a valid source to then compare to say this is what's actually going on.
So I want to understand, as a Commissioner, how you are prioritising that particular data set, because you're going to get more people who are self-harming, you're going to get more people who are incarcerated, you're going to get more children in out-of-home care, and you're going to get less children that have got cognitive issues. You're going to have more children with cognitive issues if you can't address the statistics that inform the level of violence in our communities and harm. How have you been directed to prioritise that? Will you prioritise that? Because that particular data set affects every other piece of data set. That would be my argument.
Yeah, and that is the ongoing conversations we have, Senator. So it is part of our role to then advocate and have the conversations with government agencies about data collection processes and how we can improve things, so at least we're able to report on something. And if I use the mortality rates and the suicide rates that are on the dashboard, not all jurisdictions signed up to consistent collection in the beginning, but it was a matter of negotiation over time to work out how do we get something, so at least all jurisdictions are then inputting data so we can actually report on a national level accurately, because everyone's inputting into it.
I just need to check that other senators. Sorry, I've shared the call
Can
across,
I just ask one more
but
question?
you're just checking in case anyone has what follow-up. Yeah. Yeah, I'll just let Karen finish and
Just
then I'll come to
the last question.
Yeah.
So if you've been talking a lot about the data that comes from agencies, so government agencies, what's the role that you can see that, say, the Coalition of Peaks can play in ensuring that there is better data for analysis of where we're actually at? What role do they play, and how do we get everybody playing better together.
Yeah, and they do play a role. I mean, the data reporting, all the governance arrangements that talked about, the data reporting working group, partnership working group, joint council, Coalition of Peaks is involved, and even the data development plan, the Coalition of Peaks is involved at all steps of the way. So you've got the right people sitting around the table, Senator. If I put it,
But you're talking about talking. I'm talking about the actual mechanism.
and that's the
stuff.
next step. The next step is actually starting to action the things to get people focused on what we need to do so we can get some consistent measures.
The final 5 minutes, I'll give the call to Senator Namadjima.
Thank you. Just a follow-up. I just wanted to understand whether you were able to establish a comparison between community-controlled delivery outcomes and mainstream.
No, Senator. Purely because we only collect, and the information that goes on our repositories is government data. So it comes from government sources.
And given you're having difficulty finding that data from elsewhere, do you think that there is an attitude that because there is everything is handballed to the Aboriginal community control sector as opposed to the responsibility belonging to everyone across the board?
Yeah, look, it is very much about just, I guess, seeing it as a valid data source. So it's, it's a good comment, and if I can explain it in a way that gives you a practical example of how we know it actually works and why we need to make sure that valid sources of information that sit inside community control services are actually are being recognised and included in the data conversations. When I was the CEO of the Queensland Aboriginal Health Council, so the peak body for Aboriginal medical service in Queensland, we were having significant struggles with Queensland Health at the time in recognition of antenatal visits that were happening in our community control clinics being recorded on the perinatal data collection system, because that was governed and controlled by the hospitals. And because so Aboriginal mothers weren't going to the hospitals for those visits, they were coming to where they felt culturally safe and they were being looked after in a community control clinic. They came there and they were consistently coming back, but because it wasn't being recorded on the system over here, once they had the birth, it was recorded as it then became a risk in terms of the child protection system, because they turned up to have a baby, but they had never been to an antenatal visit. And so it was about influencing the system.
But given you can't make that data comparison, you can't effectively say that one system is better than the other, is what I'm getting at, I guess.
Yeah, at the moment, and it's about the data linkage. Like that's the piece that we've certainly been encouraging in the conversations around the data development, is how do you actually encourage better data linkage, knowing that the activity that occurs in a community control service has an effect on what goes on in government services. So how do you look at the data linkage between the two to ensure that you're collecting the right information to get to the outcome?
Is there any data around perhaps when it comes to things like Indigenous legal services, the likelihood of individuals to not use those services because, as we know, in particularly in small communities, there's the possibility of those individuals, related to people that sometimes the clients don't want to engage with. Is there any kind of data collection around that sort of level of engagement?
Nothing that we have seen, Senator. So we hear the anecdotes as well. So certainly hear the anecdotes, but there's no data source that we have seen that shows that.
Okay, that's all from me.
Thank you, Senator Namadjima Price. I just have one follow-up question. Are there any additional or new targets that we need to, from your experience, need to maybe include or look into?
Thanks, Chair. Good ones to finish off on. Look, I think from our perspective, the reality is that the targets provide some robustness in focusing on progress against a range of things and actually encompass what's required for the implementation of the national agreement. Where I think, and certainly what came out of the review process, was that there needs to be more focus on collecting data against the priority reforms. So if we don't know that transformation is actually happening inside government agencies, if we don't know that there's work around data sharing arrangements, which is priority reform 4 in relation to Indigenous data governance and Indigenous data sovereignty, if we don't know that those things are occurring, we have no evidence to show that those things are occurring, then the overall implementation of the agreement then falls by the wayside.
Great, thank you. There being no further questions, and I know that we could possibly stay here most of the day asking you questions, so we're very grateful to both you, Commissioner Button and Assistant Commissioner Leary. Thank you for providing evidence to the committee today. Please be reminded that answers to any questions you've taken on notice should be provided by Wednesday, the 5th of March 2025. So thank you again.
Thank you.
We'll take a short suspension until we welcome our next witnesses. Broadcasting. I now welcome Mr. John Leha, the CEO of the New South Wales Child, Family and Community Peak Aboriginal Corporation. And I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard, will you please state your full name and the capacity in which you appear today?
John William Leha. I'm the CEO of ABSEC New South Wales.
Great. I now invite you to make a brief opening statement before I invite members of the committee to ask questions.
Thank you. I'd first start by acknowledging country and paying my respects to custodians past and present, and thank them for their continual stewardship of this community and the many Aboriginal families that make this community what it is today. And I say that by acknowledging the elders that have forged the pathway for me and for ABSEC and its legacy and the work that it does for Aboriginal communities across the state of New South Wales.
Thank you. I think Senator Little, we'll go to you first.
Thank you. Thank you, John, for your representation here today. I want to talk to you about the importance of data that actually identifies and responds to those people before children end up in out-of-home care, those that are clearly on a pathway to out-of-home care, and how we identify the number that sits within the out-of-home care cohort. We know that number because we've got data that says, you know, are you an Aboriginal child, are you not an Aboriginal child? I'm interested to understand, is there a way that we can identify that data that shows the value of diversionary services before they get to that point?
And so without being, well, not being the department and not having the full extent of their data sets, I would say no right now. From our position as a peak body of children out of home care in the state of New South Wales, but it would be remiss of me to not acknowledge that government departments do have within their remits the abilities to understand the trajectory of families that they come into contact with, be it through targeted early intervention support programs that they fund directly through any one of the service providers, be it out-of-home care or early interventions, be it through child and family wellbeing centres, medical health services, hospitals that that are also tracking the amount of clients that come through their services. So I would assume that through those data sets, you'd probably be able to get an indication of families that could potentially be coming at risk before they become in contact with ROSH. I should also acknowledge that the department themselves also note that they need to do work in preventing families coming into contact before ROSH, and so you would have known that we have been working closely with the department in really negotiating a formal partnership arrangement to actually unpack the structured decision-making tools, because it's also been proven to be racially biased in terms of the decisions that they are generating. Or notifying instances of risk where you probably needed a rather nuanced response and really have a technical perspective in interpreting some of those indicators. So it is to say that through that partnership, we would be hoping to work with the department to ensure that there are indicators and measures to really identify those families in need for investment and support, as opposed to instances of risk and removal or measures of removal. So it really is about saying how early in the continuum can we support a family, as opposed to saying how early do I need to take a child away from a family.
Right, so I just want to go into the kind of data that is useful for collection, because there is inconsistency across the states and territories. So it's pretty much easy to go, this child is an Aboriginal, identifies as an Aboriginal child, Torres Strait Islander, tick. That's another one added to the list. But what is more valuable is how they ended up there. Are they there because of addiction within the family? Are they there because of violence within the family? What's the kind of things that would be useful so that then we're not just ferrying a child into out-of-home care, we're also addressing the causal factor of how they've ended up in out-of-home care? Absolutely. What kind of data is critical to also count, not just a head and a number?
Absolutely. And I'll probably just acknowledge that there is a POCL study, which is one of the longest, a longitudinal study that is currently at play across the state of New South Wales, but it's probably an example of how data can contextualise the lives of Aboriginal people, specifically those families, and over generations. I can't not acknowledge the impacts of colonisation and invasion on Aboriginal families that continues to ripple across generations. And so when we look at one individual or child that's been impacted by child protection today, it would be negligent for us to not look at the impact of child removal, child protection on that family over decades, because what we do know is that we're instances for descendants.
But the service response has to be immediate to the issue right then, because the longer it takes, the more likely that child's going to stay in care and not ever be returned home. So while I acknowledge what you're saying about those issues, the reality is the here and now matters most to that child.
Absolutely. And so to respond to and to ensure that we're responding to the needs of that child, it is important to contextualise that and understand the family settings in which they come from and the communities in which they're a part of, because that informs the response in which that is culturally sound and appropriate for that family, who hopefully would be serviced by an Aboriginal community-controlled organisation that fully understands the intricacies of the life experiences of the individual child and the family that they're being a part of. As we all acknowledge that Aboriginal children are best placed within that family, kinship network and or community to provide those wraparound support. So it is important to understand that context when we talk about the data sets, that they're not just numbers, but what are the context behind those data sets to enable a much more tailored and appropriate response.
I just want to ask you about the concept of de-identification of children to make it look better for the statistics. Is that happening?
It has been happening.
And what does that do, and why would somebody do that?
So what we've seen, and there's only, well, I won't presume, but what we've seen is that we have been calling for the transition of caseload or work from NGOs to Aboriginal community-controlled organisations, and what we've seen is that there's a level of uncertainty or fear amongst NGOs, and so there are instances where they've gone about de-identifying Aboriginal children to not be a part of a transition process. Yeah, that's a short answer.
Okay, now, even while I've been here in New South Wales, I've seen a service that is not an Aboriginal community-controlled service that is delivering significantly to Aboriginal people with what appears to be extraordinary outcomes for those people who are in that service. How do we make sure that those people who are, obviously they're in part of the ecosystem, they're providing a productive input into improving people's lives, how do we make sure that there are enough people in this ecosystem for people to still have choice, but also how do we recognise the contribution they can make to the data, the aggregate of the data?
Yeah. And so when the assumption that we wouldn't be acknowledging them is
I'm just asking you, how do we connect them up to the data?
Absolutely. I think we all know that this is a workforce that struggles, like a lot of people, but in particular child protection, it isn't a sector that is easily recruited to, or retention continues to be a struggle for us. So it is to say that those stakeholders and those key personnel across the whole landscape play a critical role in contextualising, providing services back to our communities first and foremost. So the question really is about, do they have a role? Yes. Is there a role for them with under Aboriginal leadership? Yes. How can they continue to provide better outcomes for Aboriginal children and families is something that we would continue to elaborate on through the many initiatives that currently are at play within the state of New South Wales, but also across the country. When I think about this safe and supported national framework, the national response to the skilled framework, there are multiple layers of initiatives that are currently at play that are about bolstering the workforce and ensuring that the skills and capabilities are there, that are also not just about innovative practice, but they are culturally sound and founded in principles of self-determination. And that's not of individuals, but that's of a collective response of Aboriginal peoples. And so those NGOs who are avid supporters of our calls for self-determination and the transition process in New South Wales continue to work with us closely around how they can bring real tangible outcomes to the aspirations, which is the transition project. It is slow, I must admit, and it has been slow, but it isn't to say that there hasn't been progress, which there has.
So I asked you before about the de-identification of Aboriginal children for the reasons you gave some insight into why you think. What about and I recognise that you're here in South Australia, that's your main area of interest. South Australia, New South Wales, where I am today. Because I want to ask you a question about the manipulation of statistics in order to, particularly in the out-of-home care space. We know that resi care is not the best possible care. It might be safe for those children, but it doesn't have the best outcomes for children. Is there skewing of the data or skewing of the management of children to make sure that they don't end up in resi care and it looks better on a piece of paper? Can you think nationally? Because I've heard that it's happening in some states.
It is happening in some states, so I can't speak nationally, unfortunately, but I can give you what our reflections here in New South Wales is that it's definitely been a concern for us. There are measures in which the department have employed of late, a review into residential care, and I think that's been made public. And so those findings, yes, although they are damning, it's not of surprise to the many people that work within this sector. And so we know that the department are currently working with, well, they've gone through consultations really and seeking Aboriginal community-controlled service providers to be a part of a response that provides cultural responses in terms of residential care settings to enable that to happen beyond what they currently have. That being said, I can't speak to the data sets and whether or not it's being manipulated. Are there concerns about it being manipulated? Yes. But can I actually say that they are? No.
Okay, thank you.
Thank you. Senator Stewart.
Thank you, and thank you for appearing this morning. I feel like I've got a bunch of questions for you as somebody who's, I suppose, kind of linked to all the orgs who are doing the stuff on the ground too. But I suppose in particular I'm interested in the outcomes that are going backwards. So suicide, child protection, vulnerable kids before school age and incarceration. Would your organisation and the people you represent, they're across all those sectors, across all those areas?
Child protection is specific.
Definitely, specifically child protection. Yep. And I think the thing that I'm really interested in is, what are in your experience, why do you think those outcomes are going backwards, and what do we need to do to change that?
Yes. So I think the Productivity Commission's report was very clear around the lack of transformation of governments or bureaucracies.
Yeah.
And I think that in part is actually the most critical lever, and it's definitely been a challenge here within the state of New South Wales.
Yeah. So what does that mean in practice though? Like I feel like...
Yeah, it says, what does that, yeah.
Okay.
Yeah. What does it mean in
practice? In practical terms, like how do we...
Yep.
Like what difference
so the
does it
structured
make?
decision-making tools,
Yeah.
as an example. So that had been in place for 12 years and not been reviewed at all. So they enabled that to happen and continue. That's generations of Aboriginal children being removed by a tool that hadn't been reviewed, and acknowledged that, hey, perhaps we should have worked with Aboriginal communities to inform whether or not we continue to utilise this tool or be a part of its evaluation to say, hey, this is where it's failing our families. The number of Aboriginal kids that are continuing to be reported because of this tool would have been an indication within 12 years. Since then, they've now committed to an interim tool where they've unpacked that and started to utilise different measures to provide to inform instances of risk or notifications of risk. What they've committed to is redesigning a whole suite of tools in partnership with Aboriginal communities and peak bodies such as ABSEC to redesign a suite of tools for us to address what is the overrepresentation of kids coming into care. That transformation is really about them sharing decision making, and that probably wouldn't have taken place if we didn't have a national agreement where they acknowledge that Aboriginal people are best placed to inform decisions and processes and evaluations about us.
Yeah.
I know it sounds remarkable, right? But that's where we are in the history of this country, that the first time ever has the Closing the Gap agreement actually acknowledged Aboriginal people's agency to be a part of decision making.
Yeah.
So that's one example of transformation. The other one is obviously governments acknowledging that Aboriginal people's feedback. Even in New South Wales, we've been calling for greater transparency of investments in Aboriginal outcomes.
Yeah.
For the first time in this country, and well, in the state of New South Wales, did the New South Wales Treasury commit to an independent expenditure review of Aboriginal outcomes. That had never been done. When they did that in New South Wales, bureaucracies, departments,
And so what difference will that make?
what difference do they make? It gives clarity, transparency and accountability about where money's going and who's accountable for those outcomes.
Yeah, okay.
And a majority of the money that was going into for Aboriginal outcomes was going through NGOs and government bureaucracies. And so when we're talking about hitting the mark or the impacts of Aboriginal people on the ground and the services that they receive directly, that money wasn't being realised or those outcomes weren't being felt. And so this change and this transformation that's taken some time continues to have a ripple effect, but it is slow, but there is progress. And so I think that's why it's a critical lever in the Closing the Gap agreement is that the transformation of bureaucracies and ways of government knowing, being and doing go back since colonisation. So for us to expect for Aboriginal people and Aboriginal outcomes to somewhat transform that within the life of a CTG agreement being 10 years and we're 4 years in and I'm supposed to change the world is a fallacy. And so people need to realise if we're going to unpack and redesign ways of being and doing and working with citizens, fundamentally, governments doing better jobs at doing what they do is provide services, there is a lesson there in transforming oneself to understand the true essence of what are the issues that are impacting individual people on the ground and how we honour those lived experiences by informing policy, program and practice and hopefully legislation to ensure that there are better outcomes for mob or for people.
Because I think lots of people can see the kind of transformative stuff as not, like I don't think people can see the transformative stuff as having a link to the outcomes on the ground. I think you've kind of described it really nicely, actually, like how the decisions that government make in kind of real practical terms impact the outcomes, like kids getting removed, right? And the other question that I had, is there things that aren't being measured now that you think should be measured?
Yep.
And or, you know, maybe there are things that should be removed, maybe there are things that should just need to be tweaked to kind of more accurately reflect the aspirations and challenges of the community.
Yeah, absolutely. Accountability of government agencies and or service providers in the supposed outcomes that they're providing to Aboriginal peoples is essential.
Yeah.
The need to measure, so transition as an example, how service providers are actively supporting the shift of investment to Aboriginal community-controlled organisations, acknowledging the cultural responsiveness and expertise that they provide. How are we contractually making them obliged to shift that investment and to work with Aboriginal communities to place to support the growth of the Aboriginal community-controlled sector, which is a priority reform. Those things, I think this iteration of the Closing the Gap agreement really doesn't force or ask the NGO sector to really get behind Closing the Gap. In fact, it's their intent. We're relying on good intent, and it's the same with government agencies. Is sometimes we're relying on leadership, and so what we need to see is greater commitment of leadership across governments to enable that to happen, and really is an attitudinal and behavioural change within bureaucracies to see that happen through commissioning processes, evaluation processes, and the investment into program streams. The other, sorry.
No, you're good.
There was another measure I had, and it's probably not in these papers.
Is while you're looking at your papers there, I'll give you some notice about the next area of question that I want to ask, which is around suicide. It's a really concerning trend that we're seeing, particularly amongst our young people.
Yep.
What is it that you're seeing on the ground that's making a difference?
What's making a difference? So let me, in terms of can I go back to that last question?
No, go for it. Yeah, you can
Measures.
get
Can I also provide you with, what did they say? Take it on notice.
Yeah.
Yeah, and I'll come back and I want to make sure that we don't miss that opportunity to provide you with that information. So we'll do that in terms of what are the measures that we think that aren't being attributed or aren't being counted under Closing the Gap. I think there's an opportunity there for us to really provide you with further information.
I've got a particular view that I think we should be measuring the kind of strengths and aspirations of our community too, because I think it's so deficit focused. But I feel like I could go on forever about about that.
Yes, absolutely, and so that's why I didn't want to miss it. So we'll take that on notice and
Yep.
provide further information. In regards to suicide, I think what makes the difference is investing into Aboriginal community-controlled organisations and their responses to those communities directly is probably an opportunity that's being missed in some parts of the country. So, yeah, in short, I'll say that because I'm getting the feeling I'm going too long. No?
No, you've still got
Yeah, good.
minutes to do it.
I suppose the other question I had was, like, I suppose you kind of talked a bit about how important the transformational reform is and the kind of, and the system. And you kind of referenced some of the good investments that we had with the Safe and Supported Plan under Minister Rishworth. We've got the workforce plan, which you think is a really great thing. It's going to make a difference. I'd be keen to unpack a bit of that, but I think one of the other really important things that we've done in responding to what Aboriginal community sector have asked is the National Aboriginal and Torres Strait Islander Children's Commissioner.
Yes.
And so I suppose I'm keen to understand from your perspective, you know, given you've talked about the importance of that kind of transformational systems reform, what difference do you think that position will have on the lives of Aboriginal children?
It's a catalyst for change for Aboriginal children across the country. It's probably a position that will bring about greater transparency and accountability for Aboriginal kids and children across the country. And it's also leading other jurisdictions in how they can bring about real accountability for children and shine lights on parts of the sector and that haven't or currently aren't being addressed with the current measures that are there. When we think about accountability mechanisms, we think about the Ombudsman's Office, the Audits Report. Both of those entities agencies have provided reports that provide a scathing reflection of child protection, but yet not one of them have been able to really bring about outcomes or better or improvements or better outcomes for mob. And so the appointment of a National Commissioner has been critical, but also across each of the jurisdictions, if they have committed to, of late, the minimum standard that's being led by SNAIC, and that those aspirations will continue to bring greater accountability and outcomes for mob across each of the jurisdictions in ways that currently the landscape and the ecosystem don't. It does mean that recognising the rights of children, recognising the rights of Aboriginal people, and these are universal rights of or even human rights. These are the types of things that continue to drive those positions in bringing about better outcomes in ways that, like I said, they currently aren't doing. So yeah, it is probably one that we continue to scaffold off of, that position and the work that it does to really ensure that systems and bureaucracies are held to account in ways that they currently aren't.
And could I ask one more question before I...
One quick one.
I suppose my question goes to what accountability looks like, and like from your perspective, and I suppose I'm interested in your views about government being held to account, the Aboriginal community-controlled organisation sector being held to account, and the NGOs being held to account. What does that look like? Everyone being kind of held accountable for the joint responsibility of making sure our kids are safe.
Absolutely. So
it's a big question.
There's a lot of work that's gone into this. Like it's one of, in New South Wales, it was one of the largest consultation process with over 630 participants being a part of the development of an independent Aboriginal accountability mechanism, one in which was proposed to the New South Wales government that is continuing to be considered, but it's one that's obviously led the way across the country. The other jurisdictions, I think, have yet to develop or provide a model back to government. And so what does it mean for mob is really enabling mob to be a part of what does accountability look like for them in ways that are meaningful and where they can see that there are better outcomes for them and their families, not only in the development but the evaluation, whether or not they're actually saying that bureaucracies and agencies are doing what they said they would do. If we have, and it is to be clear that consultation acknowledged that there are entities that are supposed to already do that, be it the Ombos or the Audit Office and what have you, yet we still have a gap, yet we still have Aboriginal children being overrepresented. So if any one of those accountability mechanisms were doing the job that it was meant to be doing by ensuring that children aren't at risk and that the systems that we invest in are providing adequate supports to addressing and preventing kids coming into care or investing in families to stay strong, then we probably wouldn't need for an independent accountability mechanism. What we know is that those accountability mechanisms are failing our peoples, which is why it has been adopted in the national agreement, and obviously in the state of New South Wales we've continued to provide models. And I should also highlight that we didn't just provide one, we've provided multiple models for them to consider. We're going through a process now where the state government will continue to look at how they will ensure that that mechanism provides the impacts that we jointly are looking to bring about change for our communities.
Thank you, Chair.
Senator Namadjiba-Price.
Thank you. I just have a few questions. You've mentioned quite often the failures of bureaucracies and the need for, or that there is bureaucratic reform currently underway. And given those circumstances, you say that there is progress, but in the current closing the gap targets, we're seeing that they are in fact going backward. The kinship principle. Your suggestion, we know that this is a recommendation provided as a result of the Bringing Them Home report, and the principle has been in place for some time now. Is there any data or information around this particular principle and the correlation we're seeing between these targets going backwards?
Could I ask you to repeat that question again?
So just in terms of we know that reforms have been put in place. Your suggestion is there's a lot of failures within the bureaucracy. Right now, the kinship principle has been in place for some time in terms of child protection. Has there been any work done to understand the correlation between this particular principle and the fact that the targets are now currently going backward?
The correlation would be the absence of the recognition of kinship and the connection to community and family. So without bureaucracies or agencies understanding the cultural context in which Aboriginal children are born from, it doesn't enable them to understand the importance of placing that child back within that kinship network.
Okay, so I guess what I'm getting at is there be an uptick in terms of children being placed into kinship care, into their own family or extended family once they've been removed. There would no doubt be an increase in that since the principle has been put in place. Is that correct?
So I'm confused by when you say uptick, what do you mean?
Is there an increase in terms of children being put into kinship placements since that principle came into play?
I don't know. I haven't got the numbers, but we can take that on notice and probably provide you an answer in terms of whether or not there has been an increase. I would suspect, my assumption without seeing the data would be that yes, because fundamentally, if a child is removed, they should be placed with their families, and so it would also beg to differ that it makes sense that they would be placed there. But that's also to acknowledge that that doesn't happen all the time, and that there aren't families or extended family networks to then provide that care, and that's why we've got an out-of-home care system that is what it currently is today.
So there's no data at the moment to determine the various different circumstances and the outcomes of those children in terms of the care that they put in?
Oh no, there would be that data. So the data's there, I don't have it here to speak to.
Okay, so yeah, if I can take that on notice, I'd appreciate that. I mean, what I haven't heard so far is the correlation between, we know that there are rates, disproportionate rates of sexual abuse that our Indigenous children experience in comparison to the national rates or, of non-Indigenous children. I have heard the argument around the effects of colonisation, but I guess going back to Senator Little's point, the immediate cause for children entering into out-of-home care, I guess, I don't see, is that a significant priority in terms of overcoming this problem of children going into out-of-home care?
I might actually just simplify I think there was 2 questions in that. Or can I actually clarify the question?
Yeah, sorry, I've just not heard in any of this the causes for, and I would expect that one of the main causes for children being placed into out-of-home care are their circumstances, in that we do experience high rates of sexual abuse for Indigenous children. And is that a priority to address those causes in order to improve the circumstances for these children, to reduce the rates, if you like?
And so causes for out-of-home care in the state of New South Wales and across the country aren't it's not child sexual abuse in and of itself. It is to acknowledge that neglect, it could be housing crisis, the impacts of poverty are the drivers behind out-of-home care across the country, and that specifically in the state of New South Wales. And so it would be negligent of me to just say that was child sexual abuse. It is to say that there are a multitude of reasons as to why children end up coming into contact with the out-of-home care system.
Including exposure to domestic and family violence and those sorts of scenarios as well. So I guess what I'm trying to get at is, because there are a raft of causes, why isn't it not a priority to focus, to drill down in terms of those causes as well? I know there is a responsibility from bureaucracy, but that's sort of after the fact. So I guess what I'm trying to get at is it's treating the symptom and not the cause, if you like.
So the symptom and the cause, that rationale, so for anybody to respond to the needs of families, you'd need to probably ensure that the services were in a position to be able to provide that rapid response and investment. And in fact, you'd have the investment into communities as early on in the continuum to ensure that those instances of risk weren't actually a thing. And so that's probably where I think we could do better, is that ensuring that government agencies see the needs of Aboriginal peoples first and foremost, and invested in those communities to provide the interventions where needed, which is before they become at risk. It's about ensuring that families get access to housing, to education, to employment, to all the things that all citizens are privileged to have, and some communities take for granted, because there are communities that don't. And so when we think about how do we prevent the amount of kids coming into out-of-home care, it's about ensuring that we're providing them with the opportunities like all Australians. But again, it is important to acknowledge the impacts of poverty that is driving the overrepresentation of Aboriginal children and families.
Absolutely, and I completely understand that is a huge factor. And I guess in terms of assessing risk, is it a priority that risk for those children being placed into care, considering their environment, that they're not going to be at further risk of things like exposure to violence and or sexual abuse?
Absolutely.
Can more be done in that particular area? And that's whether or not they're in kin care or whether they're not in kin care.
Absolutely.
Yeah.
Absolutely. There's more that can be done. There's greater investment into services to continue to provide that wraparound support for them, not just within out-of-home care services. We're talking about Aboriginal medical services. We're talking about Aboriginal women's services. We're talking about a raft of responses from a service system that is that understands and knows the lived experiences of Aboriginal people by virtue of being an Aboriginal community-controlled organisation. Yes.
So, previously talking to the Productivity Commission, there hadn't been any data available to provide the comparison of outcomes for Aboriginal Community Control Service outcomes and mainstream outcomes. Do you think we can do better across that space to understand those outcomes better in those comparisons? I know that it's important to have Aboriginal community controlled, but I'm also just well aware that in some circumstances there isn't enough accountability for those measures to provide better outcomes. So would it be your recommendation that we also ensure that we're gathering the data to make those comparisons between Aboriginal community controlled outcomes as well as mainstream?
And the purpose of that would be?
Well, freedom of choice. To understand also, we know that, as you mentioned, there's women's legal services, for example, they might not necessarily be Indigenous identified organisations, but are providing outcomes for Indigenous people as well.
Yeah.
From a perspective of governments providing the funds to make those funds available to those organisations to produce outcomes.
Yeah. So your question is, do I think that you would need to do a bit of a comparison? If you'd like to, of course you can. But I think the question is whether or not, the thing is, if we haven't invested in that service to respond to those needs, then measuring it at this point in time would be negligent, right? Because you'll get the outcomes of what you've got now. Until we see a strong Aboriginal community control sector that's been invested to proportionately to the people in which we serve, it probably wouldn't give you an accurate reflection of the true impact of Aboriginal community service responses to the needs of our peoples. And so that's why I think it probably premature is probably the word, and that to do it at a point in time that would be ensure that there was equity in the data sets or the results that might be considered in that evaluation might be more fruitful in determining how we would then provide investments or services or service response to communities. If that
I guess what I'm getting at is, how do we understand if there are elements of the Aboriginal community control sector that are actually providing the outcomes that we need? How do we know? And how do we know in terms of the mainstream sector, whether the mainstream sector are equally or perhaps doing better than or worse than, is what...
How would you know that? Yes,
yeah,
and that
that's
totally comes from the bureaucracy. So they've got contracts, and in those contracts there are accountability measures and reporting mechanisms, and so you'd hope that with strong contract management mechanisms within those bureaucracies, you could actually ensure that people are hitting the mark. What we've seen, though, over decades, and that predate this iteration of closing the gap, is that despite those agreements, Aboriginal people are still disproportionately represented across each of the targets. And so what we've acknowledged through the national agreement is that that's an issue, and that we need to invest in the Aboriginal communities to actually be a part of the solutions. So the first time that that's ever been done. And so what we're seeing now is that we're enabling for communities across the country to be a part of the solutions in which that they're being impacted by the issues, but also the solutions. Does that help?
Can I, sorry, Senator Namatjira Price, I just need to share the call, and then I can come back to you if you have a follow-up, unless you have a quick one.
Yeah, I'll just have a quick one, but I'm going to have to leave soon anyway.
No
look, I guess I'm just trying to understand, because there has been an increase in terms of supporting the sector more broadly, as well as providing the opportunity to have more input, Coalition of Peaks, for example. But what I'm not seeing is, I guess, the improvements within the reporting, the closing the gap report. It's not correlating, if you like. So I'm not convinced that. I'm just not convinced of exactly what you're trying to suggest, is that it is wholly and solely based on Aboriginal people, organisations, continuing to fund organisations where there's probably a lack of accountability. That part, you know, I can understand, but with all such investment already having taken place, why are we not seeing the improvements that we are wanting to see more broadly?
Yeah, and so I think it's seeing seeing targets or progress against targets in isolation. And so I think if I didn't capture that in my response earlier about the transformation and some of those examples being the independent treasurer's expenditure review, the partnership, the agreement that we have here, Aboriginal-led commissioning projects where Aboriginal people are leading procurement processes. It is to acknowledge that the journey in and of itself is also a product of closing the gap, and it has in itself provided better outcomes in that ways of knowing, being and doing are being considered in bureaucracies that have never done that before, centring Aboriginal lived experiences in processes such as policy, procurement, evaluation, and then being able to ensure that the services and the programs that they receive are actually informed by them, and so that they are hitting the mark when it comes to ensuring that they're getting better outcomes from that process. The other successes that I should probably have highlighted in this process is that the establishment of government agencies have heard our calls for transformation, and the ministers, in particular Kate Washington, has established a new department, a systems reform division within the Department of Communities and Justice that continues to drive sector reform. The Minister has also established a ministerial Aboriginal partnership group, which has seen Aboriginal leaders, elders and people with lived experience be a part of informing the responses by the New South Wales Government in providing services back to community. It's the first time that that's ever been done. What that's meant is that the priority reform one around shared decision the priority reform around shared decision making has been able to come to light through the national agreement and its commitments. This is the first time in many years where people are formally being acknowledged for their knowledge and lived experience to inform the reform agenda. It is to say that the government's acknowledgement of a broken child protection system could not have been done without the advocacy of Aboriginal people over decades and generations that continue to forge a way forward for Aboriginal children and families being impacted by the out-of-home care, the statutory out-of-home care system that currently exists.
And there's a lot of work to be done.
Absolutely.
Thank you, Senator. I just have some follow-up questions, Mr. Leahy. In your submission to the Productivity Commission review, you stated that there was little evidence of the whole of government priority reform shifting. So I just wanted to get some clarity on the last question. That new reform department, has that been instigated since then around transformation?
Within New South Wales, the Department of Communities and Justice.
Yeah, within that also, that submission, you also stated there was a failure to recognise that redistribution of power. Have you seen that shift since the new?
Not as much as we need it to. So there's shared discussions. Decisions is probably the operative word that is missing from some of those arrangements, and something that, as I said, there is opportunity for governments to improve, and bureaucracy in itself, in its ritualism, that continues to be a challenge for bringing to light CTG in the national agreement. And so sharing decision making is something that is a growing thing, but there is progress, slow, very minimal progress in government agencies understanding the aspirations of closing the gap.
Yeah. And can you give us a practical example of what you might think that redistribution of power might look like from an ABSEC perspective?
Yeah, shared decision making. So there's a policy that the department has a policy called the ACMP, Aboriginal Case Management Policy. Within that is they've got mechanisms called Aboriginal Community Control mechanisms that really are about enabling Aboriginal communities, local Aboriginal communities, to be a part of shared decision making. What we've seen is that local districts across the state have not acknowledged those entities and those those groups as part of their formal proceedings to inform. To acknowledge the formal decision making or provide advice back to government decisions that are being made about whether or not they remove a child. And so there are examples where they could empower those ACCMs that hold up their own policy to enable local people to be a part of decision making around what are the types of supports we might give to that child or that family within their community context, and or whether or not we need to step with the department or the system needs to step in and actually remove a child. That's one example of where power can be shifted, where they acknowledge the agency of community and allow them to participate in decisions that impact an Aboriginal child or a family. Yes.
Hopefully that can be done in the future. You also talked a little bit about in that submission to the review, and just picking up on Senator Namajimpa Price's question, that government should increase the share of funding that ACCOs received until they achieve parity with the share of Aboriginal children, young people and families using government-funded services. How big is the gap there? Do we know?
Yeah, it's huge. I think Aboriginal service providers are receiving about less than 10% of investment to provide care, and what we know is that their Aboriginal children make up nearly 50% of out-of-home care in the state of New South Wales. So there is a lack of investment in, and it's very clear that there is a lack of investment into ACCOs to continue to provide wraparound supports, not just for kids in out-of-home care, but the full continuum of care, you know, to the point of prenatal supports, to the point of family and domestic violence wraparound services, to the point of parent, like there's a raft of services that government agencies have siloed their investment programs, which has made it difficult for ACCOs to scale at rates in which we require and they desire, and that's not being met by current contracting models. And so what would be beneficial or would support the growth of ACCOs in certain areas would be a flexible funding model for them to be able to provide the tailored response to communities or to families in a way that they're best suited to and play to those strengths. But that's not the way that the system is built. The departments have got priorities and they've got program streams, and the PSP program is an example. It had a review which was damning, and that actually a lot of money went into that program, and yet very little outcome was felt by Aboriginal families and children. And so the review of that and any recommendations from that have yet to be seen, but it would still continue to highlight that in that procurement process there was very little Aboriginal community controlled organisations that were actually commissioned, and that the majority of out-of-home care system and services are still being procured from the NGO sector, if not by the department themselves. And it must reflect that the department and the role in which they play is one that also is rather obscure, in that they are a regulator, they are a service provider, they are also somewhat an evaluator, but they're also the people with the purse strings. So when we think about how we the procurement processes and the ways in which we want to bring better outcomes in investment approaches to Aboriginal people, you'd think that an Aboriginal-led commissioning model, one in which ABSEC had provided to the department and back to the state government, is one in which would bring confidence back to Aboriginal people, but also a level of independence and greater accountability of investments and outcomes for Aboriginal people in ways in which the department currently aren't doing, if that makes sense.
Yeah, it does. And I think from my procurement days, I'd like to draw on the fact of outputs versus outcome-based sort of funding models and contracts that are definitely a very key facet of procurement policies across the country, which, you know, from what I'm hearing from you, hamper particularly ACCOs from achieving some of that one flexible funding that allows them to achieve that, but also that it's driven by bean counting versus actually achieving a much more holistic outcome
Absolutely.
for families and children.
And even the transition project, what we're seeing now as a critical barrier is that carers deciding that they don't want to be part of a transition project and they want to stay with an NGO, and that they don't really understand the uplift that comes from being serviced and supported by an Aboriginal community service provider, which is paying homage to their human right to be connected to culture, country and kin. And so that's also been a barrier, and that government agencies or ministers aren't really getting behind that and saying, you know what, there is a real impact to the identity of young Aboriginal people and an uplift in that if they are being nurtured in a community that they can see themselves in. And so without that commitment and leadership from government ministers and agencies to provide confidence to carers who are caring for children, and they're caring at a point in time, that those children still remain connected to culture and to family. And so without them having that connection of forging those relationships, there's a missed opportunity, and there is the continuation of a generation of stolen generation, or kids that don't know who they are or where they belong. And so we need to ensure that as a service system and as a government response, that when they do go looking to find who they are and where they come from, that the system can provide that response. Sorry.
I'm just going to share the call. I know that Senator Little has a follow-up question, so I'll hand the call to her.
Thank you, and thank you for raising the issue that you've raised here, and that is, you mentioned about the government agency being the regulator, the provider and the banker. You also, I've heard you talk a lot about ACOs and the role they play. You're a peak body. I put this question to the Coalition of Peaks the other day, and that is, when you talk about more Aboriginal community-controlled operators, and you've raised the issue of 10%, only 10% of the funding, despite being 50% of the cohort. What role, is there a better role for peaks to play, or what role do you currently have in weeding out those operators that are in the ecosystem within the Aboriginal community controlled space, because that's the only space you can really control, and you are a peak body, who are actually not participating in evaluation, not reporting, and quite frankly are running family businesses with taxpayers' money as if, rather than being focused as they should on only and solely the clients that they exist to represent. Is there a stronger position for peak bodies to play in improving the regulation of their ecosystem because you are peak bodies?
Absolutely.
To improve your argument of we should get a bigger share of the funding, we should be better resourced, recognising too that some of those bigger operators who aren't in your ecosystem get the money because they know how to do this stuff.
Yeah. And so I should acknowledge that there are agencies that are already, so there are regulators, the Office of the Children's Guardian, who also has a key role in accountability and ensuring that those service providers are doing exactly what they should be doing.
Have they shut any down though?
I don't. Oh, they have some have lost accreditation.
Right.
So if
okay.
that's what you mean by shutting
Yes.
down, they have lost accreditation. Right. But there are processes for them to embark on to either getting reaccredited or not. Even the department themselves have also been unaccredited, one of their districts, and they had gone through a process of ensuring that they could. So does to answer, yeah, if that gives you some understanding. What do I see of the role of peak bodies such as ourselves is to continue to highlight where the gaps are in the service system and for them to strengthen the response, whether the control be and whether or not the peak plays a role of accountability, of ensuring that all service providers are abiding the Aboriginal child placement principles, is a measure in which I think had been highlighted in a report from the OCG, but one that wasn't fully embedded or appreciated. So do I think the role of peaks traditionally, I believe that there is an opportunity to transform and evolve with an evolving landscape, and that the role for peaks is rather nuanced in one, given the different jurisdictions. But there's an opportunity for us to have a greater say in ensuring that the ecosystem is being responsive to Aboriginal children and families in ways that they currently aren't.
So currently as a peak, do you actually have within your purpose a responsibility to actually effectively whistleblow on those organisations that you see, because you're at the coalface and you're on the front line, are not doing the right thing even before the regulator becomes aware of it?
For the regulator, so we also run an RTO. As part of the work that we do as a peak is to ensure that we're providing responses to the needs of those member organisations and Aboriginal community-controlled organisations or NGOs. A lot of our clients are NGOs who are looking to increase their cultural capacity. Through that RTO, we work closely with all organisations to ensure that they're being provided governance training, they're being provided with practice updates, they're being provided with short-term courses, long-term courses, diplomas, but it is about understanding that the workforce shortages and the governance challenges and the corporate functions that underpin any one of those organisations are seen as opportunities to invest in, and so that's our role as a peak to continue to do that before they get to that point. Whether or not organisations take that as an opportunity with two hands and say, yes, we want this training, or whether or not they've got the means to invest in that is another thing, and so that's why there is an opportunity for peak bodies and government agencies to work closer to bring about better outcomes for those organisations. So it's not just about saying, here's some training, do you want it or not? Can you afford to pay for it, for that to be implemented as well? Not just to go for a training course, but do you have the ability to sustain practice and governance practices to ensure that the quality of service in the organisation in and of itself can stand on its own 2 feet?
Thank you.
Thank you. That concludes our session with ABSEC. I would like to thank Mr Leahy for attending today's hearing. Please be reminded that answers to any questions you've taken on notice should be with the Secretariat by Wednesday, the 5th of March 2025. Thank you. The committee will now suspend for morning tea. We'll resume again. I now welcome Dr. Clinton Schultz, the Director of the First Nations Strategy and Partnerships at the Black Dog Institute. And I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, will you please state your full name and the capacity in which you appear today?
Yeah, for sure. Thank you. My name's Dr. Clinton Schultz. I'm a Gomeroi man. My capacity today is both as the Director of First Nations Strategy and Partnerships with the Black Dog Institute, as long as board member for Gayadjui Proud Spirit.
Excellent. I now invite you to make a short opening statement before I invite members of the committee to ask questions.
Thank you. So I guess my opening statement is, at the heart of this inquiry must be a commitment to working in ways that empower First Nations peoples and communities, ensuring that the measures we use, like the Closing the Gap targets and the policies that they inform, are not just being about tracking outcomes, but about actively supporting the conditions that allow our people to thrive on our own terms, and that those must align with the social-emotional wellbeing approach. Social-emotional wellbeing is a holistic concept that encompasses the physical, mental, spiritual and cultural dimensions of health. And from a First Nations perspective, social and emotional wellbeing emphasises connections to law, culture, spirituality, ancestry, family and community. It is inseparable from our ability to live strong, connection to law, culture, language, country and kinship. Ongoing impacts of colonisation continue to minimise the importance of these domains, leading to government-led strategies that do not bring about the changes required and desired by us as First Nations peoples. Disparities in the determinants of social-emotional wellbeing, including, but not limited to, ongoing exposure to racial discrimination, both personal and systemic exclusion from economic and social opportunities, and the erosion of cultural knowledges are further key drivers of social-emotional wellbeing disturbance and the regression of closing the gap targets, particularly on the rates of suicide. A failure to implement recommendations out of previous reports that have been undertaken at government levels, such as the Royal Commission into deaths in custody, along with the Bringing Them Home report, have added to the disparities that we see in social-emotional wellbeing for Aboriginal and Torres Strait Islander people. Addressing these issues requires more than just service provision. It demands a structural shift towards genuine self-determination, cultural revitalisation, and revitalisation means acknowledging our law, L-O-R-E, restoration of access to opportunities to strengthen our identity and to form a positive identity in who we are as First Nations peoples, resilience and collective healing. By prioritising initiatives that increase access to learning law, language and culture, and embedding First Nations knowledge systems within education, employment and health frameworks, we not only improve social-emotional wellbeing outcomes, but also create pathways for our people to build a strong and positive self-identity. One that is grounded in the values, traditions and knowledge that have sustained our communities and our families since time immemorial. The continued rise in suicide rates among First Nations peoples is a policy failure, not an inevitability. By embedding social-emotional wellbeing frameworks, workforce development, early intervention, family support, lived experience inclusion and First Nations-led research, we can transform suicide prevention and ensure our people live strong, connected and thriving lives. So in closing, the key points I'd like to make is the regression in closing the gap targets in suicide rates reflects a failure to centre social-emotional wellbeing in policy, funding, programming and workforce development. Current approaches focus on crisis response rather than prevention, early intervention, lived experience inclusion, workforce capacity and capability and culturally embedded healing. Systemic and structural racism continues to impact on mental health access, workforce retention and funding for First Nations-led services. And failure to support First Nations children's and families in early years is contributing to cycles of social-emotional wellbeing distress, child removals and youth justice involvement. We must shift measurement and funding priorities towards social emotional wellbeing, workforce development, early intervention, family support, lived experience inclusion, and First Nations-led research. Otherwise, we will continue to see poor mental health outcomes and increasing suicide rates.
Thank you. I'll now hand the call over to the Deputy Chair, Senator Stewart.
Thank you very much, and thanks for appearing before the committee today. The first question I've got is, I suppose, about the things that we measure and the kind of overarching narrative that exists about Aboriginal people. But I suppose I'm interested in, do you think that kind of only measuring things that are about our deficits has a negative impact on people's mental health and wellbeing?
Yes, I do believe it does, on a couple of levels.
Yeah.
One, what we're measuring is reactive. So there's a lag response in terms of what we're actually capturing data on. So we're capturing data on death rates, on removals. There's a lag rate in that. And there's a lead up to those statistics coming about. So I don't think we're doing enough to capture information about what's going on that's leading to the outcomes that we're actually seeing. We're more focused on the outcomes and just how do we reduce the immediate outcome. And I don't think without turning our focus to causality, we're going to do much about shifting.
Symptoms. Focusing on the symptoms, not the cause. And what are the things, in your view, that we need to be measuring, for something like suicide? That's very obviously kind of...
Yeah, I think we could shift our focus to be a lot more strength-based in terms of the data and the information that we're trying to source. Things like what suicide prevention opportunities, resources, etc., are available at a community-based level.
When you say like measure the things beforehand, like what? So, because I mean, one of the questions that I will ask you when you can't. So I'm interrupting you, but one of the questions I'll ask you: what are the things that are missing from the things that we're measuring now? That should be either tweaked. Maybe there are things that exist that are okay but need to be tweaked, and then what are the things that should be removed that don't do us any good?
I think we really need to start with looking at the social determinants, cultural determinants and historical determinants that are drivers or the greater influences of overall social and emotional wellbeing. We're really good at capturing data on what we kind of recognise as the big five social determinants: housing, education, employment, food security and financial stability. But I think we've had it suggested to us as First Nations peoples that those are the things that should be most important to us, or the things that have the greatest influence over our lives. I think we could be putting more effort into looking at some of the determinants that are more prominent from a First Nations social emotional wellbeing perspective, and that would be localised. So finding out what is important to people in terms of influence over their overall social emotional wellbeing. There is other ones that I think we can be capturing data on that we probably don't, and we probably don't put enough attention and resourcing into. Things like the experience of being incarcerated or having a family member incarcerated. That's a social determinant that most people don't ever have to experience, but you'll struggle to find any of our families who don't have that as a lived experience. The experience of being removed or having a family member removed is a social determinant because we have over 3% of the Australian population who are highly exposed to that social determinant as compared to 97% who aren't. So when we start to look at some of these statistics and the way that they can then intergenerationally have influence, I think there's information there and opportunities to resource that we may not have had our focus on previously. I think another really important one is the opportunity for children to learn their mother tongue. We understand ourselves as First Nations peoples through our connection to country, and our language comes from country. If we're not offering young people the opportunity to learn that language that connects them to country, we're avoiding an opportunity to help forge one of the most protective factors to social emotional wellbeing, which is connection to country.
And so do you think if we were to, measure things like how much time you got to spend with your family this week, or how many times you went to hang out with your mob at whatever, like measuring the things that give us a sense of connection and belonging, all that kind of stuff, we could do the correlation between if this is high, then you're less likely to, end up with kind of challenges with your mental health or kind of go down the path of.
Yeah, if we take the social emotional wellbeing model that's, captured within the Working Together textbook, and then a whole bunch of government documents that have come from that, like the National Aboriginal and Torres Strait Islander Suicide Prevention Framework, the National Framework for Social Emotional Wellbeing, etc., it gives us very clearly a guide to the domains, elements that First Nations peoples have expressed are important to their overall wellbeing. So I think we have that information about what should we be looking at.
Yep.
I don't think we've got far enough in terms of how do we measure that.
Okay.
And I think that's one of the reasons why funding First Nations-led research in that social emotional wellbeing space can help us move forward in a positive direction, because we're yet to figure out how do you unpack somebody's connection to spirituality? How do you unpack somebody's connection to family or community as compared to another? Like,
It's hard to do in one question, right?
how do you put that on a scale?
Yeah.
So I might feel that I have a strong connection to community, and somebody else might view that and go, well, I feel that you've got a weaker connection to community than what I potentially have. So I think we're yet to be able to figure out how do we deal with the variance of experience and understanding of those domains amongst First Nations peoples. But we've got a good, clear idea of what is important.
Yeah, because the system finds it easier to measure how many contacts you've had with police.
Simple statistics that generally, as I said, have had a lag time and are the presentations of histories rather than they are issues in themselves.
And I'm interested in, and I don't know if you can answer this question for me or not, but I suppose the kind of experience of the country, community, whatever, of First Nations people kind of post-referendum. Like what, you talked about, experiences of racism. So I'm keen to understand. I feel like anecdotally I've heard.
It's not just anecdotal, so there is actual research being undertaken at present. So we're working on a piece of work with ANU and the team there at the moment, looking at, I guess, the impact of racism and the episodes of racism, both during and then post the referendum.
Yeah, okay.
And we can clearly see that there has been an increase in racism and the experiences of racism amongst First Nations peoples since the referendum. But with a history starting with the lead up to the referendum.
Yeah.
So I think that's an important thing for us to be able to recognise as well, is that this didn't just all of a sudden happen in October, that there was a lead up that led to people in the Australian public feeling like they had more of an opportunity or a right to express views that can potentially be very damaging to the well-being of other Australians. And I think that's why in the work that we were doing at Black Dog during that whole period, we were really focused on trying to get people to undertake the process in the most respectful way as possible, and being mindful of social emotional wellbeing and the impacts that discourse can actually have. So that's one element of it. We know that the more that people hear deficit discourse about themselves, the more likely it is to eventually soak in some shape or form and take hold, to start to have an impact on their overall perception of self and therefore their overall well-being. So in psychology, we'd call it self-fulfilling prophecy, and it's been an accepted philosophy or theory forever in psychology, but we've never applied that same rationale to considering the way that discourse is undertaken about First Nations peoples, particularly in public forums, be that within media or be that within politics, and how that can actually influence social emotional well-being of First Nations peoples. And the general public, because when we see media or we see other forms of public discourse being undertaken in particular ways, that has influence over how other Australians feel they have the right to talk, to act.
And does the research that you're undertaking with ANU look at the economic cost of racism?
It's one of the things that we're potentially looking at.
Yeah.
We haven't unpacked that yet.
Yeah.
We do know there is an economic cost because we know that overexposure to racism is one of the leading causes for disengagement, be that from health, be that from employment, be that from schooling.
Yeah.
So we know that there's a disengagement element, and we're yet to look at, okay, what is the cost of that? But yes, there definitely will be a societal cost to exposure to racism.
Yeah, because I think our mob already contribute a huge amount to the economy, and there are lots of kind of challenges and barriers that kind of hinder further achievements. I think one of the areas that hasn't necessarily been looked at a whole lot for us is the experience of like racism in the economy in that kind of economic contribution way. So I think it's, fascinating. And I know I'm going to start running out of time soon, but what are the things that you've seen make a difference on the ground for people in terms of mental health and wellbeing? It'd be good to kind of hear some examples of that.
Long-term grassroots-led initiatives. So probably one of the biggest issues that we have is that we have really short-term funding cycles at that sort of localised level. So programs get initiated, trialled, and then they dissipate. So people are left having potentially have received some benefit from those, but then the offside of that is they're cut off from it. And so the opportunity for continued improvement disappears, as well as the opportunity for others that didn't have opportunities to engage with short-term programs becomes an issue as well. So short-term funding, I think, is an issue that we commonly see, and a helicopter perspective. So we come into a lot of the policy and programming space for First Nations peoples thinking that we can apply this helicopter perspective of one size fits all. And we just know that's never going to fit. The diversity that exists amongst us as First Nations peoples, even if you just look at it at a simple level of urban, rural, remote, is great enough in itself to require different approaches. But you can then take that further to look at the diversity that exists within those geographical zones, areas, contexts, etc. So I think as long as we continue to just try and apply helicopter approaches and think that it's going to fit for all First Nations peoples, we're likely to see limited benefit. So again, that reinforces the importance of looking local and working local, and really looking at how do we empower people with both lived experience, cultural knowledge, and community context to inform what is going on within their communities.
That requires a skilled workforce.
Absolutely.
Like my background is in, like, I'm a family therapist by trade. So certainly appreciate the challenges that exist in mental health.
I think a great example we have is Palm Island. So I'm from Queensland, I live in Queensland. You know, Palm Island 15 years ago experienced a lot of concerns across pretty much every domain within social emotional wellbeing framework. They've done a lot of work over that period of time to bring back community control to Palm Island, to work in collaboration and partnership only with agencies that it chooses is culturally responsive to the needs and desires of Palm Island, and to really empower people within that community to take ownership of their community and therefore their social emotional wellbeing within that community. And I think what we've witnessed from that is a great increase in most of the indicators that we'd be discussing here.
Yeah, and I think I suppose I'm keen to understand. I think it was last week now. It feels like forever ago, but the federal government announced 100 scholarships for 150 First Nations psychology students, which is, I think it's pretty great. On top of the 250 last year, do you think that's going to have a big impact on workforce? I know it's not the only solution, of course, but it's one of the.
I think we need a lot more of those programs.
Yeah.
We need to acknowledge that social emotional wellbeing requires interdisciplinary responses and interagency responses, to be honest.
Yeah.
So it's great that we're getting those scholarships and that workforce built up in psychology.
Yeah. You
But
need
what
to
does that
carry-
mean for those other fields that need to be working in partnership with psychology, social work, nursing, Aboriginal health practitioners, et cetera, et cetera?
Yep. We're doing paid prac for them. Yep.
Absolutely. So
Free TAFE.
we need
All the things.
You know, overall we make up less than 1% of the overall health workforce in Australia as First Nations peoples. So we know that we're far below parity as it is. So we need to be doing a lot more about how do we just at least bring that up to parity and beyond, given requirement of need within communities. So any programming that we can be looking at that not only gets people in, but then the big problem we have is keeping people in.
Yeah.
So my PhD work was all looking at the social emotional wellbeing of the Aboriginal and Torres Strait Islander health workforce, health and community services workforce. And we know we have some of the highest turnover rates of any workforce in the country. Unfortunately, we also have some of the highest suicide rates of any workforce in this country. And that's because it is difficult working within systems that were never developed
Built for us.
for you, your family or your community. So my field, psychology, for instance, like it's great, we're going to get another 150 people through psychology, but psychology still needs to do a fair bit of work in terms of being inclusive.
Yeah.
Being
even systems
culturally
and
responsive. And I think
systems
Arnie
and family
Pat
oriented.
and others have made leaps in helping to bring that about, but we'd be fooling ourselves to think that we are there.
Yeah, no,
So,
I agree.
yeah.
Yeah.
I'm just going to share the call, Senator Stewart, if you're finished, to Senator Little.
Thank you. I just want to get some clarification of the research you mentioned before. Is that underway or is that almost finished, or where is that
The
at?
work with ANU,
Yes,
it's,
the work on the suicide work that you mentioned. Because you drew a distinction between rising suicide rates and the referendum, and you put that on record, and I'd like to ask you a
no, I
question
actually
about that.
never made that.
Well, you
Distinction.
you did make a reference. You spoke about the referendum, and then you spoke of increasing rates of suicide in that period before and
So
after.
increased rates of social emotional wellbeing disturbance,
I
which,
think we might go back and have a look at the transcript. But the reason why I asked you this question is there are two other things that happened in that period of time, and one is the removal of the cashless debit card, and the other one is the removal of those alcohol restrictions in the Northern Territory. In the month following the removal of those restrictions in the Northern Territory, there was a 77% increase in family violence incidents reported. And in that year following, there were 66,000 hospital admissions in Alice Springs for a population of 27,000 people. So that's why I raised the issue. There are other things that have also occurred in that period that may influence those results.
yeah, I know, I acknowledge that. I also, at the same time, would suggest that the Northern Territory is just one jurisdiction, as Alice Springs is only one jurisdiction within.
We've seen the same results in Ceduna. We've seen the same results in other places. I just draw your attention to that, given your comments. I do want to ask specifically, and I raise those issues specifically in the context of family violence, because in terms of family violence, there is a increase in, and you might be able to shed some light on what this looks like, in women who are self-harming and ultimately taking their lives that are attributed to suicide, but the causal impact might be violence, but it also might be perpetrator intervention. Do we need to understand, when we unpack these statistics, more about what those causal effects actually really are?
Absolutely.
Because unless you actually delve into it, you're not really going to know.
Yeah, I'd absolutely agree. And again, this is an issue of sometimes we're just looking at outcomes rather than we're looking at causality, the histories behind what is leading people to be, if they're coming to me, a presentation in my room. If it's an outcome such as suicide, what led to that? So I think we definitely need to be doing more work in that. I'd suggest also that with regards to family violence, and not just family violence, all forms of violence at the end of the day are a coping mechanism. They're a negative coping mechanism, but they are a coping mechanism. So we need to be looking at, if we really want to attend to the family violence, what is it people are trying to cope from? What have they been using to potentially negative cope that has led to the violence? And the violence is a flow-on form of the coping. And then what is it that we could do to help start implementing more opportunities and resources for positive coping, while we're working towards removing the situations and the circumstances that are leading people to feel like they have to negatively cope.
I want to ask you something about cognitive impairment in very young children and the increased risk profile of that cognitive impairment that might lead to exploitation, it might lead to poor decision making, it might lead to behavioural issues and therefore potentially neglect. I'm just wondering if the data actually gives you the tools at the moment to understand what's coming rather than data that tells you what's happened.
Yeah, I'd suggest Arnie Lorien-Hayes is the best person in the country to contact about that. She's an expert in the space of FASD, and she would be the best person to give advice on that situation.
So just on that cognitive impairment stuff, FASD is one thing, but then we've got cognitive impairment from, you would know this, children who are born into violence, which that's all they see, there's no external exposure to anything. That's brain underdevelopment as well by the time they even hit 2 years old. So I'm wanting to understand, there's been an increase in the access to technology, phones, computers in Aboriginal communities, and we know from the data that we are prolific users of social media, particularly Facebook. We also know that there is an increase in some of those remote communities of fight clubs, and thank goodness the E-Safety Commissioner has intervened a couple of times to shut those down, which increase violence, which increase pressure. I'm interested to know, there's another example of increase in social media, lack of understanding about individual responsibility in relation to use. How do we actually identify, and that's not FASD, how do we get a warning signal about what's coming our way that will ultimately contribute to those statistics going the wrong way?
Yeah, well, what we do know is trauma does have an impact on cognitive development, as it does on all actual aspects of social emotional well-being. So it doesn't matter if we're looking at physical development, cognitive development, or mental development, or connection to family or community. We actually know that there's impairment that can be driven from trauma in all of those. So children who are exposed to high levels of trauma or experience high levels of trauma are more likely to have impairments form and show at some level of their social emotional well-being. For some children that may come up cognitively, for some children that may come up in different physical attributes, for some children that may come up in terms of behavioural and societal concerns and issues, disengagements.
So if you have a look at the Close the Gap report that was handed down last week, you can't compare it to the previous report. It's difficult for, I think, somebody who's interested to know what's happening in an area. Disaggregated data isn't really a feature of this. So how could the data for your work be improved given the limitations we've seen just in the last week of the value of the data? Because you can put as much data as you like, as you know. It's about the value.
Yeah, if you're not asking the right questions of the data, also you're not going to have an opportunity to find the answers to the questions that you'd like to pose. So I think one of the first issues that we have is identification within data, and again that is a difficult thing given the diversity that exists amongst Aboriginal and Torres Strait Islander people's experiences. So, you know, when we're again going out and we're saying we just want to do a bunch of research on Aboriginal and Torres Strait Islander children between the ages of 7 and 13, for instance. Well, if that's the only parameter that we're putting around it and we're capturing data from kids who have very different experiences within urban settings to those that, say, may have in Alice Springs, and that data starts to, I guess, mix in with each other, I think that there's an issue then of us not picking up some of the key drivers or concerns within the data. So I think we need to do a lot better at, one, identifying data, but also setting the parameters better so that we actually know we're asking ourselves the questions of the data for the answers that we actually we need. So, you know, making sure that we're not comparing data as a whole, but we're, you know, at the moment we compare Aboriginal and Torres Strait Islander children with non-Indigenous children, and I think that's problematic because the experiences of Aboriginal and Torres Strait Islander children are so varied.
And I'm glad you raised that because it was raised before. There's been a 25% increase in the one census to the other of the number of people who have identified as Aboriginal. And therefore there's a diversity of experiences amongst that, which is likely. I mean, you don't have to be Einstein or a statistician to understand that that's going to impact the data, and as you disaggregate that, it might actually impact that more. So how do you influence what you actually need from the data to make sure that we're identifying where the most vulnerable children are, whether they're living in a metropolitan area or they're living in a remote area, where those most vulnerable children actually are, so that the resources are diverted more to those places of urgent need?
Yeah, it's a good question, and it's definitely not something that I think we're doing well, or that we've probably even figured out how to do the best we possibly can at present. I think it does require, as you said, to really disaggregate the data through asking questions, putting better parameters around that data from the forefront of the research that we're actually doing, rather than trying to, I guess, build them in at the later stages. Potentially, you know, if we're wanting to look at specific concerns or specific issues in specific regions, then localised research is what's going to actually give us the answers for that community in that context. I don't think then we should be taking that data and trying to use it in a completely different scenario, community context. So it really, for me, comes back to that notion of the importance of localisation in terms of both looking for what's going on and then looking for the answers, and therefore what we can do about those.
So there's 19 targets, 19 I think at the moment. I know your answer is probably going to be all of them, but for the area of your specialty, what are the key targets that need to have a difference made to make a difference to where you are? Because you're the ambulance at the end, right? I'm trying to understand which are the most important targets for you to make a difference, to stop the train even getting to the end of the tracks.
Yeah, I think there's two sides to that again. I think we need to be doing a lot more in terms of looking at what's going on with children, because children are our future. So we really need to be looking at what's the experience of children now, and what is it that we can do to improve those experiences. So, you know, for me, you know, attending to it from a law-based cultural perspective, it's about understanding, I guess, the difference between Burugul and Burugul Niley. So Burugul being that for everywhere and for every when of the dreaming, what people will talk about as the dreaming. But Burugul Niley actually being about what is my part, what is my position in that for everywhere, for every when story. What do I want to choose to add to that? And how do I go about doing that? So with children, when we have a better understanding of what's going on for them, what has their story been so far? What has led to the presentations that we're potentially dealing with and the stats that we're all talking about? That will then allow us to look at how do we make that story better into the future. But at the same time as doing that, I don't think we can forget that we have a whole bunch of people who are already experiencing distress. So I think we've gone through this argument for a long time now in both policy and application in terms of, if I want to do more in this space, I have to remove from this space, rather than recognising we actually need two big buckets of support and funding. We can't remove what we're doing in the, let's call it, postvention space, while we're doing work in the prevention space. But yes, we can definitely be doing more in the prevention space, and I think that starts with us having a better understanding of what is the story so far, the journey so far of our young people, so that we're not repeating not having to repeat the post-vention into the future.
Just focusing on domestic and family violence, and in some communities, because of the way communities are structured, if family violence is involved, there's no escape.
Yeah.
So I just wanted to ask about the role of violence in an escalation pathway for somebody towards self-harm. We've seen in some places 20% increase in violence. It's an epidemic across Australia, but in the worst places we've seen 20%. In regional places we've seen up to 150% increase in any 1 year in incidents reported, noting that many aren't reported. What in your experiences could we do in that space better to reduce harm to people, whether they are victim survivors, witnesses as children, or even perpetrators?
So I think it goes back to what I was saying earlier about violence is a form of negative coping. So, and it's an explosion of emotions at the end of the day. So we need to be looking at why is it that people are getting this pent-up emotion which eventually explodes and comes out as violence. And that within that we're actually talking about uncontrolled violence. You know, there's many forms of violence on this planet, and some of them will legitimise, like a football game's pretty violent, but we'll legitimise that as compared to uncontrolled violence being forms of domestic violence, family violence, personal violence, etc. So I think it's important that we're separating what form of violence is it that we're actually talking about here, and it's uncontrolled violence, which is driven by emotion. What is driving the emotion? Why are people having these pent-up experiences that are leading to these emotional responses? That will then allow us to look at what can we do about that? What are the circumstances? How can we attend to those circumstances in a way that it is less likely that people are going to end up exploding?
I mentioned earlier about the underreporting. Do you have any insight into how we can possibly change or how we can collect data on that huge proportion of people that don't report at all, whether they are witnesses, perpetrators, victims, survivors? How do we actually get a better picture on the size and the impact of that silent cohort? Because they're not in the data.
Yeah, I think that's going to come about through helping people to normalise talking, normalise reporting. And that's going to require looking at two notions, I think, stigmatisation and shame for our mob. Shame's a powerful emotion for our mob. So, as is stigmatisation. So I think at one end of it you have people who choose not to report because of the stigma associated with either being a victim or a perpetrator. There's stigma on both sides of that. And then I think on the other side is also levels of shame, again, on both sides, for both perpetrators and victims.
This is my personal theory, I'll declare that up front, but I have a suspicion, you know, we're talking about people in the Aboriginal and Torres Strait Islander community that are really struggling and difficult, and that doesn't mean that those struggles aren't the story of people who appear to be very successful, as it is in all societies. What I'm interested in is your insight into whether there's a group of people who are doing quite well, thank you very much, in the Aboriginal and Torres Strait Islander community, who are actually really sitting in that silent majority that actually aren't doing so well. And how do we reach that cohort who have got you know, the cap on at the moment, everything looks okay, you know, on the surface of the water, but at some point, how do we work with those people to get better intergenerational outcomes?
Yeah, I'd bring it back to those two notions of attending to stigmatisation and shame. So I think we can be doing a lot more support, education, etc., with helping people to cope with the presence of stigmatisation and the experience of shame, which is then more likely to lead to them feeling comfortable in reporting. And at the end of the reporting also is that what we want people to do is be receiving assistance to be on a healing journey.
So what's the data set that would tell you that you're making inroads if you're doing that?
I don't think at present that we're capturing that.
Is it attendance at education or some, I don't know, exposure to specific campaigns? I don't know. That's what I'm
I think for me, again, I think it's this issue of, you know, our societies within Western systems are very linear. We want evidence to drive our response, but our ways of knowing, being and doing is circular. And so maybe we need to start with the responses that can help us to drive some evidence, and then we can reinforce back to response. And I think that linear approach potentially at times gets in the way of us doing things that we know have potential to make difference, because we're constantly asking for the evidence first, but there isn't opportunity to build evidence without first trialling, doing something.
Thank you.
Thank you. Thank you, Dr. Schultz, for appearing today. I just wanted to go back to earlier today. We had some evidence from the Productivity Commission, who were in here telling us about the lack of data around the national priority reform. So we don't have any data to give us a picture around how across jurisdictions we're actually achieving some of the shared decision making, and not to mention within a really important target such as suicide and mental health, we have no jurisdictional data. So my question really is around definitions, and I noted that the Black Dog Institute had a document that they put out in 2022 that wrote, it is unlikely that the term depression is, as it's understood, measured, diagnosed and treated, is suited to First Nations populations. Yep. Given that the evidence we've already received is that there's not a shared definition of what we're trying to measure, and exactly to your point, it's very linear in what the discipline, I suppose is a better word, represents, and yet our understanding of social and emotional wellbeing. How important do you think that is to shift the dial around the way broader society looks at mental health and suicide, and we as First Peoples have a very different construct of what that looks like and its interconnectedness? Yeah, thanks. I personally don't think social emotional wellbeing is a First Nations only understanding or perspective of wellbeing and being, to be honest. I think it's a human perspective, but it is definitely more a collective-based experience and perspective. And I guess we have, as First Nations peoples here in Australia, you know, we have the benefit of being members of a collective society, whereas the majority population of Australia come from an individualistic society. So while I believe that it is a human understanding, I think that the more individualised societies become, the less, I guess, attuned they are to the importance of certain elements of their overall well-being. And I think, you know, COVID was a prime example of this. You know, when people were all of a sudden disconnected from their families or from being, you know, out in nature, etc., they realised, wow, these things are actually important to me. So I do believe that they're important to everybody, and we kind of witnessed that, which I think is a good thing. In terms of, so I wrote that statement that you brought up before, and that is because what may come up as a diagnosis of depression has been come to from utilising tools and measures that were never developed from a First Nations perspective. So certain elements that they're looking for within that, when you put a cultural lens on them, could be a completely different thing. Yep. So sitting in silence, for instance, may be seen as isolation through something like that, whereas it could be a cultural practice for somebody else. So I think we need to be careful in terms of what is it that we're picking up when we're using measures that have never been statistically validated to be used with groups of peoples. And we've got a real problem in Australia of constantly using
Western metrics to try and measure not just First Nations peoples, but a whole bunch of other cultural groups in Australia who hold different perspectives. So we need to do a lot of work around that in terms of how do we ensure that we are using tools and measures to capture data that is actually relevant to particular groups. And that'll give us a better understanding, I think, of what really is going on and what we may have to do to better outcomes.
Thank you. That makes a lot of sense. I too come from a trauma background. I've worked in the area of domestic violence and sexual assault, and the importance of trauma recovery for our communities. And when you talk about the collective nature of that, and I think during your opening statement you mentioned that causal factors, and you mentioned in particular the removal of children and individuals versus also having a family member that's been removed. Noting that this target is very individualist in the way that we actually gather or haven't been able to land on a proper target data gathering tool, how important would it need to be inclusive around the trauma recovery, which is whole communities and whole families that have had that experience, which we, from my knowledge, are not doing, and you might be able to shed some light on that.
Yeah, I think when we're working from a social emotional wellbeing perspective with collective-based peoples, we need to recognise that we're never working with individuals. We're always working with individuals who in themselves are cells of larger entities, being family, being community. So being able to do that larger group-based, whatever level it is, family, community type intervention is paramount to us actually making a difference in this space. I think when we're only working with individuals who potentially, specifically when they come from collective-based societies, is actually we're missing a large piece of what is actually going on and the responses that we're trying to put in place. So yeah, I think we need to be putting a lot more resourcing into whatever you want to classify that group-based intervention. As I said, you know, we're getting better in Australia at resourcing family-based therapy, for instance. Like we've historically been pretty poor at it. So the majority of our funding has always gone into individual interventions across all the mental health sort of spectrum. We've gotten better in that space, but I don't think we've really figured out yet how do we resource and how do we implement community-based responses when it comes to things like trauma.
Yeah, even though we've funded, like previous governments have funded suicide clusters, I suppose was the word that they used for the Kimberley region, who have had and still do have one of the highest rates of suicide in the world, that we still haven't cracked the nut in, like, what do we actually do that helps whole communities recover, heal, and actually stop that driving of crisis need or intervention that's required for those communities when we do see cluster suicides happen. And I don't know if you've got any insights.
Yeah, I think we've started to get some good information in that space when you look at reports like the ABSEC report that Auntie Pat Dudgeon and her team completed a couple of years ago, and I guess flow-on information that has come from that report. That was looking at a community response and I guess the benefits within that. And that has led to further pieces of work at looking at systems responses to suicide prevention. And at the end of the day, and I'm sure I highlighted it in my introduction, was the importance of systems responses. These aren't issues of individual despair. These are issues of collective despair that require systems responses. So, yeah.
The latest National Aboriginal and Torres Strait Islander Suicide Prevention Strategy, I'm going to pronounce this wrong, but it's Proud Spirit, Gayadawi.
Gayadawi.
Yeah. Have you had any involvement in that, or were you involved in any way?
Yeah, I was involved in the development of that. As I said at the beginning, I'm on the board of Gayadawi. And so, yeah, I've had quite a lot of opportunity to review both through the production of that material and then I guess the publication of that material.
Yeah. And way back since ABSEC, we've had lots of strategies. What will make this one different? What will make this a success, I suppose, to ensure that we are actually going to see progress and that we're actually going to see resourcing in the right way and we're actually going to see the right investment in the right places. Like, is this different from what we've seen before?
In terms of what's in the document, there probably isn't great variance between what's in the document current and its predecessor.
Okay.
What we need to see to actually bring around change is a proper response to what's in the document. And that requires two things. I think it requires us to acknowledge that we need to be working in partnership between community, agency and government, and that we actually have to be prepared to resource the initiatives, the recommendations that are put within any of these documents, be it the National Aboriginal and Torres Strait Islander Suicide Prevention Framework, be it the upcoming National Aboriginal and Torres Strait Islander Social Emotional Wellbeing Framework, the Gay-Dewey Declaration. I think those three documents bound together are really good frameworks for how we can do this together. And if there is anything of significant variance between, I guess, their predecessors, is the highlight of systems responses, rather than, which have always been present, but probably not to the degree that we're calling for them now.
Okay. I'm heading into the final stages of my questions. I'm curious to ask this question, because Target 14, when I looked up on the Productivity Commission's website, talks about the measurement of this outcome, talks about significant and sustained reduction in suicide, like there is no self-harm mental health.
Yeah.
But it goes down to some, and they've in fact included a new indicator at 14A around hospitalisation for self-harm. And they still have the indicator 14D around psychological distress, indicator 14E around barriers to accessing health service. Do you think that we have the right set of indicators for measurement of success in relation to that?
I've always personally had a little bit of an issue with the way that we worded the item. I think we've set some unrealistic expectations, which as human beings, when we set unrealistic expectation, what we actually do is we remove motivation. So if I'm setting a net zero target for something that it's probably something I'm never going to achieve. But in doing that, what I actually do is I decrease the motivation, be that personal or systems based, to achieve an improvement, because it's easier to kind of have no response or limited response than it is to feel like you had response and failed. And so when we set these impossible targets, I think we really do run a risk of us not having the proper motivations to achieve positive gains. So for me, that was personally, that was a part of the issue in that, is we decreased opportunity by setting the target. And I understand why it was worded that way, and it's very ambitious, but it's an unlikely scenario. We are never going to remove suicide completely. There are so many drivers towards that outcome that we're never going to reach a net zero with any population. We can greatly decrease, absolutely, I believe that, but I don't believe that we're ever going to meet a net zero. So we need to better look at, okay, what is a realistic target or measure that gives us an indication of improvement that we can both, again, personally or within communities or within government, we can feel like we've achieved, and will give us further motivation to continue on that trajectory.
Yeah, and probably if you have some of those ideas that you might want to give to us on notice around what they might look like, I'm sure the committee would love to receive those. And just noting there are other targets across, in particular the other three targets that are regressing around school attendance and prisoners' legal status and our cultural support plans for kids. So they've added some new targets in. But I was particularly interested in this area and how we can better improve, one, the way we talk about it and the definitions that should be agreed to around exactly what you're saying, how we do prevention better, how we have earlier intervention, rather than just the ambulance at the bottom of the cliff, crisis management and intervention, which seems to be in some instances where people like to be able to see an immediate result, where it's harder to measure prevention, especially in this case. So thank you. I don't know if you've got any further comments, or were there any? You've got like 30 seconds.
Can I just ask you a question about, Senator Cox mentioned about the far north Western Australia having some of the highest rates of suicide in the world. They've also got one of the highest rates of FASD in the world. Yeah. Can you make a comment about the strategies that actually target particular cohorts and how successful that would continue to be, or what we should do differently so they actually are successful in changing the statistics that appear in the Close the Gap?
Yeah, my comments on that, or my reply on that, would be to, one, get in contact with the people that are the experts in that area and in that space. So I'd be getting in contact with Arnie Lorraine Hayes for the information around FASD and what can help, really help, in terms of us improving outcomes for people who do experience FASD and their families. And on the other end of it, getting in touch with Arnie Pat Dudgeon in terms of the work that they did up in the Kimberley, particularly through ABSEC.
Thank you, Dr. Schultz. On behalf of the committee, I'd like to thank you for attending today's hearing and giving evidence. Please be reminded that answer to any questions that you may have taken on notice are due by the 5th of March 2025. And you can contact the Secretariat if you have any concerns. So thank you.
Thank you.
And we'll now break for lunch. Broadcasting. I now welcome Ms Shaquille Robinson and Ms Yasra Metwali, representing the Aboriginal Women's Advisory Network. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, would you each please state your full name and the capacity in which you appear today?
So my name is Yusra Metwali, YUSRAMETWALLY. I'm not sure if you asked me to spell it, but I'm a lawyer.
It always helps.
I'm trying to do that. And my role is Policy Advocacy Officer.
Hi, my name's Shaquille Robinson. I'm the Acting Program Coordinator of A1.
Great. I now welcome you to make your short opening statement before I invite members of the committee to ask you some questions. Okay, thank you.
So the New South Wales Aboriginal Women's Advisory Network welcomes the opportunity to respond to the Senate's Select Committee's inquiry on measuring outcomes for First Nations communities, tasked with inquiring into the current regression of the Closing the Gap targets on the rates of suicide, the number of children in out-of-home care, adult incarceration, and the number of children commencing school who are developmentally delayed, developmentally on track. Sorry.
So today's focus will be primarily on adult incarceration and number of children out of home care. But first, we'd like to begin by acknowledging traditional owners of the lands on which we meet, the lands of the Gadigal people. And I extend that acknowledgement to Aboriginal women present with us in the room, and elders past, present and emerging, and acknowledge that this land always was and always will be Aboriginal land.
Yeah, and I would also like to acknowledge that we're meeting on the land of the Gadigal people and pay my respects to elders both past, present and emerging, and extend that respect to all the Aboriginal and Torres Strait Islander women and men that may be present in the room today. My name's Shaquille Robinson, like I previously mentioned. I'm a proud Dungari Bundjalung woman, and I'm joining you with Yusra. So
I'm the Policy and Advocacy Officer at A1.
So the New South Wales Aboriginal Women's Advisory Network was established in 2022 and operates as a mechanism to drive Aboriginal-led policy solutions to the New South Wales Government's Closing the Gap Target 13 initiative to reduce the rates of all forms of family violence and abuse against Aboriginal and Torres Strait Islander women, children by at least 50% by 2031 as progress towards zero. Currently, Aboriginal and Torres Strait Islander women are 33 times more likely to be hospitalised and 57 times more likely to be murdered from family violence than other Australian women. The life expectancy for Aboriginal and Torres Strait Islander women is about 10 years less than the national average for Australian women. These statistics are unacceptable. A1's Executive Council is led by co-chairs from Warringah Bay Aboriginal Women's Legal Centre and the Aboriginal Legal Service New South Wales ACT. The ALS is the coalition of Aboriginal peak bodies lead on Target 13. Warringah Bay is the organisation that auspices A1's Secretariat. Both Warringah Bay and A1 are gender specific and sensitive to cultural diverse needs of Aboriginal and Torres Strait Islander women and children, victims, survivors of domestic, family and sexual violence. A1 works to reduce violence against Aboriginal women and children through following multi-pronged approaches: educating community around issues of domestic, family and sexual violence against Aboriginal and Torres Strait Islander women and children, empowering Aboriginal and Torres Strait Islander women across New South Wales with opportunities to provide their insight on issues that impact themselves, their families and their communities, representing Aboriginal and Torres Strait Islander women's voices to government and also to frontline services, advocating for better protections and supports in community for Aboriginal and Torres Strait Islander women and children. Whilst our consultations are ongoing, we have visited numerous regions across numerous communities across New South Wales. In December 2023, the network also held a statewide conference around domestic, family and sexual violence, which hosted over 100 Aboriginal and Torres Strait Islander women from urban, regional, rural and remote communities across New South Wales. Our network has a membership of more than 400 Aboriginal and Torres Strait Islander women from across New South Wales.
I just want to note that due to the short turnaround of being invited to present today, we were not able to hold specific consultations. However, our insights today and in our upcoming submission are informed by the ongoing consultations that we hold, and again, we intend to hold some further consultations to inform our written submission. So we thank the committee for inviting us today.
Great.
So to ensure that we make a concrete change to address the regression of closing the gap targets, we need to first of all be very conscious of the data. For Aboriginal and Torres Strait Islander people who've died between 2013 and 2022, the 5 leading causes of death have accounted for over 1/3 of all deaths. Those causes are heart diseases, diabetes, chronic lower respiratory diseases, lung cancer and suicide. These deaths are largely influenced by social determinants of health factors that have a significant impact. These factors are greatly influenced by factors like income level, educational attainment, employment status, neighbourhood quality, access to healthcare, racial and ethnic background, and social supports network. Essentially, the conditions in which people live, work and play can greatly influence their risk of developing chronic diseases like heart disease, diabetes and respiratory illnesses. In relation to suicide, while the data is limited, our anecdotal evidence from our consultations points to a correlation between suicide rates and domestic and family sexual violence. So we do believe that there is a need to strengthen data collection in relation to these correlations to have a greater understanding of the statistics that we are dealing with. Essentially, these social determinants of health show that we basically need a whole government approach to reduce family and domestic sexual violence as well as to close the gap, and that there is a close correlation between the two. A1's position is that the experience of family violence is the Aboriginal and Torres Strait Islander person's connection to the other factors and other targets within the system, whether that be the child protection system, the youth justice system where there is over-representation, as well as housing and homelessness, health, access to education and suicide rates. There is therefore a need to ensure that social determinants of health factors are addressed through an evidence-based and culturally appropriate lens by ensuring that community-based interventions are utilised and to ensure that these are delivered by Aboriginal community control health sector, or rather by the Aboriginal community control sector. We need a whole government approach to addressing each of those target areas. Federal, state and territory governments need to put in place the correct machinery to facilitate the necessary cross-portfolio coordination and a nationally consistent approach to achieving the closing the gap targets. These connectors mentioned are further compounded or exacerbated when Aboriginal and Torres Strait Islander community members reside in regional, rural and remote communities where there is restrictions on the availability of on-the-ground services, both in relation to general health services and domestic violence-specific services such as refuges, as well as overstretched Aboriginal liaison officers working within police. In contrast to siloed government responses that have been the standard for quite a while, we advocate for a uniform, holistic and consistent strategies that will improve responses in the family violence policing and criminal justice system, as well as the child protection, housing and corrective services systems. These approaches will work towards addressing many of the targets that are outside of the remit of A1 within the target 13, but we wanted to emphasise the close correlation between many of those targets.
Great, thank you. Thank you for your opening statement. I might kick off the series of questions and then I'll pass on the call to other senators that are here. Just in relation to, I just want to pick up that point around your development of a national survivor-centred uniform model response, I think was to sexual violence that you've previously talked about. Under the new indicators that have been added under Target 13, they've linked one to the specialist homelessness services for the reason for family violence with accompanying children. Do you think that's reflective of what Arwen is seeing on the ground?
So do you want to read the question?
So they've linked an indicator in order to measure data that is about women who, I would say it's more women, who are seeking assistance from specialist homelessness services for the reasons of family violence, who are accompanied by children. It's a new measure that's now being put in place to bolster, I suppose, a broader picture of some of those intersections that you talked about. Do you think that's reflective of what you're seeing on the ground, as well as measuring hospitalisation for family violence? Yet we haven't got one for poverty or economic status, which is a little bit unusual, but also some of the other issues where we know that there are high rates of family and domestic violence or women's experience of violence during pregnancy, for instance, that link across to other parts of the ecosystem and particularly into other targets. Do you have any comments about that?
So it's a step in the right direction, but there's also a need for healing houses. These are things that have come up in our consultations. Healing houses for both men and women, for men to be able to access unnecessary supports when it comes to addiction, as well as aggression, and so that's taking the lens of healing needs to be incorporated into the language when it comes to targets, because that addresses the need for really going to the root of intergenerational trauma that has an impact on Aboriginal and Torres Strait Islander communities, but also the fact that there's a need for healing for women who've experienced domestic violence, but also for men who partake in and use violence. So one of the things that we've consistently called for is having targeted approaches around, for example, we've got groups who are coming out of the criminal justice system, where there's overlap with the other target of reducing incarceration. But there is such a strong connection and correlation between women who are in custody. Aboriginal women are also very much overrepresented as those who are incarcerated, and there's a high portion of those who are victims of domestic violence. And what we see is that there is a lack of trauma-informed support being provided to them. And there's also a need for a more trauma-informed approach that takes into account the fact that trauma in many ways manifests in substance abuse, and there's such a severe lack and shortage of services that are those early intervention services that lead to and contribute to entering the correctional system. So I hope that answers your question. There's definitely a lot of overlap. In regards to health, I wanted to note one of the case studies, or one of the models that are quite successful and help in breaking down silos is the health justice partnerships, and that takes into account the fact that many women are more likely to seek help or be in contact with a health service, particularly when it comes to maternity care, for example, than a legal or with the policing system. And so there's a need to strengthen those systems so that we have a no wrong door policy for women who seek assistance through the health pathway, and that despite the fact that many health services do screen for DV, they aren't necessarily equipped with all the tools needed to respond to the wide range of issues that arise.
During the Missing and Murdered First Nations Women and Children's inquiry that the Senate Legal and Constitutional Affairs Committee finished last year, recommended its findings a nationally harmonised set of data that gives us a better picture on the rates of family and domestic violence that are happening in First Nations communities. It's yet to be responded to by the government, but how does that impact in a jurisdiction like New South Wales with getting a clearer picture of what that looks like and how you are funded, how you can work on advocacy, empowerment, representing women's voices and advocacy, how does that ratio start to build itself against a very well-resourced mainstream, position that is run by well-resourced NGOs? So when we talk about refuges and things like that, how does that work when there is no data? So the Productivity Commission this morning told us there's still no national data that tells us the story of family violence for First Nations people in this country, which in 2025 seems unbelievable, but it's happening. What does that mean for Arwen? And what does that mean for the First Nations women here in New South Wales?
Yeah, so I think a lot of the time when we're going out to regional communities and stuff, it's quite apparent, like there's a community in particular that stood out to me in New South Wales, and I think it's about 40 kilometres out of a major regional community. And within that community, there's no domestic violence services. The local police station is only serviced from 9 to 3:30. And the safe place within that community is the local hospital, because that's the only place that has doors that actually can close, and there's video surveillance. But when in a lot of our consultations and things like that, and then when we're in comparison to non-Aboriginal services, we are really under-resourced. And I know a lot of the capos are also facing the same issue. Ideally, we would like to do a lot more work than what we are actually doing, but we just don't have the resources to do that. And also, I think in terms of funding, I feel like we could be better funded as well, especially when because we're not even, when we're looking at, things like, funding just in comparison to other ACOs, we're not even, competitive with, job rates and all that type of stuff in comparison to them. So I feel like the Aboriginal community control sector needs to be better resourced.
And to add to that point by Shaquille, that the way that the targets are funded definitely need to be increased, and they need to reflect the strong language in the national agreement about handing power to Aboriginal communities. So there needs to be a much higher investment directly into the priority areas that have been identified by Aboriginal women and communities, because that's what empowerment looks like. And just further to the priority reform areas, our network does want to emphasise that the principles of transparent funding allocations, prioritisation of funding for the Aboriginal community-controlled organisation and the community-controlled sector, and accountability for funding allocations from government cuts across all priority reforms under the Closing the Gap and the associated New South Wales implementation plan. There's also a need for greater pay parity when it comes to what funding is received, because that has a flow-on impact on workforce issues. So that's another factor that needs to be taken into account when comparing government organisations. Right now, there is an imbalance with how partnerships take place with Aboriginal organisations. There's a lack of resources that leaves community-controlled organisations at a disadvantage in contrast to government agencies, and it creates a disparity when attempting to progress partnerships between community-controlled organisations and government agencies. But there's another point that we want to highlight, and that is, and this is also connected to the priority areas of transforming government organisations, that there needs to be a much higher level of accountability around how culturally safe and responsive to the needs of the Aboriginal community is in relation to mainstream organisations, which includes the health services, because of the amount of money they receive. So an example that I want to highlight is a mainstream organisation, 1-800 Respect. That's a recipient of $253.4 million being allocated over 5 years. And they're the National Counselling, Information and Referral Service for people affected by domestic, family and sexual violence. However, the access of services by Aboriginal and Torres Strait Islander women is lacking, and that was highlighted in an independent evaluation of the service. So alongside funding Aboriginal community control sector, there is also a need to be very critical about how accountable mainstream organisations are to ensure that an Aboriginal person is able to access the services they need and that they're not at a disadvantage. And that would be something that we would advocate can be a target that's added in terms of how services are accessed, that there should be a specific target that would hopefully bring a more strength-based approach towards the targets, rather than being on that deficit lens, but to actually encourage the uptake of services given the flow-on effect that we see across all the target areas by lower engagement with essential services.
Great, thank you. And Senator Stewart,
Thank
you.
you.
The call on.
Thank you very much, and thanks for appearing before the committee today. I've got a bunch of questions. I suppose the first one I want to ask is, what is it that we might be missing because we're not measuring it?
So it's as simple as accessibility of services by First Nations and Aboriginal communities.
So like the 1-800 Respect example that you just gave.
Yeah, so looking at, just give me 1 minute, please.
No, that's all right. I know that's like, I feel like that's a very broad question.
Yeah.
So,
No.
so that's completely fine. And you also might have things that come to your mind after this that you're very welcome to put on notice as well.
Thank you. Would you mind repeating your question again, please?
I was asked, what is it that we might be missing because we're not measuring it properly or capturing it properly?
So targets should focus on the accessibility of services by both mainstream and ATO services, to continually have a lens of assessing and evaluating their level of cultural safety and effectiveness. And
do you think that's particularly for mainstream services?
Yeah, mainstream services particularly, especially when it comes to health services.
And they're getting Aboriginal dollars?
Yeah.
And what we find too when we're going out to communities, a lot of the communities will say, oh, you know, mainstream services receiving all these Aboriginal dollars and our people aren't accessing them, or if they are, they're doing, you know, very little to actually assist those Aboriginal people, and then they're referring them on to ACOs to do the more, you know, trauma-informed, intensive kind of case management and work. But a lot of the time within communities, they're saying to us that they would like, you know, Aboriginal oversight into the funding and actually have Aboriginal communities monitoring you know, the services that are being, you know, implemented on the ground, especially by mainstream services.
Okay. So they want to be able to see where the money's going, so they can say, all right, money's going to this mainstream service. It means that we've absolutely got a right to go and access that service because they're getting black dollars.
Yeah. And they want to be the ones to, to pretty much measure those outcomes and then the actual work that's happening on the ground.
Yeah. Okay. Sorry, I interrupted you.
No, that's fine. Please continue. Have any other questions?
And I mean, we've seen, and you've talked about this a bit, like we've seen the, you know, for the outcomes in particular going backwards. And you said that you were going to focus on child protection. I mean, you talked a bit about suicide too, and justice. What are the things that you've seen make a difference on the ground? Like, there are specific things that you think, there might be particular programs, but it also might be, here are the kind of key aspects of these programs that make a difference, and if you can put those things into mainstream programs or whatever it might be, you'd see a substantial difference for people doing it tough, really.
Yeah.
Yeah, so with a lot of our consultations and stuff, I feel like the best approach is place-based solutions. So every community that we're going to, you know, we will meet with, you know, mainstream services. We'll also meet with Aboriginal community control, but we'll also meet with, you know, because when we go to a lot of these services, they will usually say, oh, you know, there's an auntie in this community that does specific work. There's a lot of groups usually that are not funded, that are just kind of, you know, run by the goodwill of, you know, a lot of community women, as we know. And a lot of the time, those women, like when we do the consultation, we'll ask them, you know, what do you think will work best for your community and stuff? And the community have the answers. They will literally tell you, like there was that particular community that I mentioned earlier, that's, you know, 40 kilometres outside of a, you know, major regional town. They literally, like, they had approached, you know, their local land council and stuff to get a building, and they actually had spoke about their approach from, you know, what they envision this healing centre, domestic violence support service to look like, and, you know, the types of things that will be run from that. And there was literally women across that community that were willing to do that for free. So, you know, a lot of these communities just really want to reduce, you know, the violence, the rates of, you know, child sexual and adult sexual.
And has that been going for long enough now that you've seen the impact of that?
No, so with that particular program, it hasn't been implemented. Yeah. But with that community, we've done a couple of visits there, and we've also taken the New South Wales Women's Safety Commissioner out there as well, and she's visited and heard from those women directly. So we're hoping to see, you know, some government investment in that particular community, because, you know, things like that we think would be, you know, just so basic, like transport for women escaping DV, and, you know, when they're calling Link to Home and stuff, they're literally being given taxi vouchers to escape, but there's no taxi service within that community. And for one, like with the community that my family comes from, I know there's no taxi service there either, and then there's no phone reception around the mission either. So I feel like in some of these towns, like things that are so, you know, basic, like transport and stuff like that,
Connectivity.
You know, there's no investment there. But with that particular community, you know, there's one bus and train service a day, and there's no community transport options. So if the woman doesn't have, you know, a family member to drive them into the next regional town for safe accommodation, you know, they're literally left to their, you know, own devices. And then if they're going to catch that public transport, the perpetrator's going to know where to find them, what time to be there and stuff like that. So it's, you know, really kind of simple stuff, but I really feel like the communities have the answers, but it's just a matter of, you know, government implementing what the communities are saying.
In relation to, so some programs that make a difference as well, make a huge difference actually, is if we were to look at really having targeted approaches to groups where there is an overlap. So again, looking at women in custody who are overrepresented, and there is such an overlap with domestic violence, that there is such a huge vacuum in an opportunity to have influence real change by being able to target programs while women are in custody. They are in a unique opportunity where they're from what my personal experience is working as a solicitor at Warringah Buyer, is that there is a commitment to wanting to turn their lives around. But unfortunately, they're not always given the tools and programs available to them. And so what we see is that there is such a limited programs that comes to post-release planning, or opportunities to actually address, critical health needs like addiction. And so if there was a more targeted approach, we could see an opportunity to actually shift the dial with that group. And there's also an overlap with out-of-home care because of the fact that the very real reality of having children removed, being in that situation, and highlighting those needs for a lot of support services. But one of the things that is that's very a very key experience of Aboriginal women is that there is a fear of engaging with support services when there is a history of having children removed, and that's obviously tied to, the very recent history of having the stolen generation and the overrepresentation of Aboriginal children being in care. So we see a level of fear when it comes to engaging with the very important support services that are needed. And so that's why there needs to be some really targeted approaches towards how we improve accessibility of services. And one of the things that have come up in our consultations is, you know, calling for empowering communities to get the services that they need, whether that be in the form of a one-stop shop or, you know, having services available to to perpetrators to address the cause in a way that women don't feel policed, because that is a big barrier currently that's impacting women in preventing them to access the support that they need as well as
So, sorry, just because I've probably got to get the wrap up in a second. I've kind of spoken a bit about this today, but I feel like we measure so much of the deficit when it comes to our mob. If we were to measure something in the positive, what would be the measures of success? What would Aboriginal women experience? An obvious one is obviously kind of being less unsafe situations, but at the kind of, I don't know, entry level to programs, or when they pick up the phone or whatever, like what are the things that you think?
The engagement with support services.
Yep.
That's the measure of success.
Yeah.
And that entails, you know, health services as well. So, including, you know, your drug and alcohol addiction support services, domestic violence support services, and same thing goes with men, where we don't often see the same level of emphasis being placed on men to access support services. Rather, the onus is on the woman to access the support services, but seeing more of a targeted approach.
Emphasis on the woman escaping violence, not the men.
That's right.
Not the male stop using violence.
That's right. So to have those targeted approaches is important, and it's hard to measure healing, but it underpins. It really gets to the heart of all violence, as well as a lot of the targets that that Closing the Gap speaks to, and that's particularly, you know, and that is about having holistic support. So I think a measure of success is seeing how much we see programs being targeted for whole of family and whole of community, rather than being seeing silos. And yeah, I think as well there's definitely underpinning healing is actually going to the root of self-determination, and in recognition of the failed referendum vote, working towards reconciliation really gets to the bottom of some of the root causes, addressing the social and emotional well-being.
Yeah, exactly. I think we're good at kind of, we do a better job at capturing all the things that's not happening in our lives. But I suppose I'm interested in what are the things that we're doing well at, to look after our kids, to look after our families, and how do we increase those things to reduce the risk factors, as opposed to, like all the deficits and stuff that we measure. Anyway, like, I'm happy for you to kind of take that on notice too, and if there are other things that you think, when you kind of out chatting with people, you think, these are the things that give our women and families joy and make them feel safe and secure and all that kind of stuff that is worth us knowing about, that I'll be interested in those things.
I think we can talk a bit about, what healing looks like. So we've heard stories about programs running custody evolving, like weaving programs, this, focus on healing being connected to culture, doing something with your hands, and the fact that not taking a Western lens, for example, to mental health support services, but really looking at how it's tied to culture. So there are many examples of case studies that work well, and we'd be happy to share with share with that in a submission. And I think the thing that we want to emphasise is that to make sure that when there are good models, that they're expanded and run across the board so that no one misses out. So, when I hear about a prison program being run for women in Wellington, I feel jealous on behalf of my clients who never had access to that in Derwynia. So we want to make sure that, things that work well are duplicated across the board, obviously in a way that is that takes into account the place-based needs.
Yes. Yeah. Yeah. Thank you. No, sorry. I know that I've got to share the call.
Cut you short, but yeah, if you can provide that on notice, that'd be great. Senator Little's got a couple of quick questions.
Okay, rehabilitation facilities for treating addiction that can take families. Is that commonplace in New South Wales or not?
My understanding is that there are rehabilitation centres that allow children to attend, but the spaces are very limited. So demand is huge, and there's a need.
And
for
there,
more.
just on that point as well,
Yeah.
there's no, to my knowledge, there's no Aboriginal community-controlled organisations that facilitate those kind of rehabilitation as well. There is, to my knowledge,
Families,
with families, yeah.
Okay.
I think there's only. Yeah, so there's the Glen, I don't know if you're familiar with the Glen for Women up on the Central Coast, but to my knowledge, that's the only Aboriginal women's rehab in New South Wales.
Right, okay. But you don't know whether they take families?
No, they don't take families.
Okay. And you mentioned about transition from custody. Are there any programs here in New South Wales that actually help women transition from custody back to their families and communities, and do work with both families outside and families inside?
There's the Miranda project is a project that provides support to women from certain LGAs.
Okay.
But there are very limited support services that are available to women across the board. So we'll be highlighting case studies in our submission. Is there anything else you want to add to
Happy
that?
for you to provide that on notice.
Yeah,
if you'd like to.
that'd be great if you could provide that to
So
us.
I've just got the last question, and I hope you can keep this brief, but I'm really interested to hear your view on it. I've heard in other conversations the issue of, you mentioned about women seeking services and the pressure on women to actually seek out help, which then creates a record of evidence that could be potentially used against them in the family court system. But that same risk doesn't actually apply equally to men, because there's obviously generally not a propensity to go and seek the help as there are with women. Is that something that you see often?
Definitely.
Yeah. It is something that is always front and centre for women who are going through family law proceedings, and it's a barrier. It is a barrier to accessing support services.
And I think especially too, if it's Aboriginal women and a non-Aboriginal partner, definitely we see that a lot.
Okay.
Thank you so much for your evidence today and attending the hearing. We appreciate the time that you've taken and appreciate how time sensitive that was for you, and we really look forward to your submission on this important inquiry, given your breadth of knowledge. Please be reminded that answers to any questions taken on notice are due within 2 weeks on the 5th of March, which is a Wednesday, 2025. So we'll have a short break while we welcome our next witnesses. Miss Imogen Edison, the CEO of Create Foundation, and I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, please state your full name and the capacity in which you appear today.
My name's Imogen Edison, and I'm Chief Executive Officer of the Create Foundation.
Great. Did you have a opening statement?
I do, yeah, thank you.
So once you've given that to us, I'll invite committee members to ask some questions.
Great, thank you. I feel really grateful and humble to be on Gadigal land today and pay my deepest respects to elders, knowledge holders and community leaders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people in the room today. I want to start with being really clear about my positionality and the limits of my voice in this conversation. I'm a non-Aboriginal person and I'm representing a non-Indigenous organisation. So Create really is here as an ally, showing up in solidarity for the Aboriginal community-controlled sector, who are really the experts when it comes to outcomes for community and wellbeing for their kids. So Create Foundation is the national consumer body representing the voices and rights of children and young people in out-of-home care and those with a care experience up to the age of 25. We're not a service provider, we're a systems advocate, and we're independent from both government and the out-of-home care sector. And as a systems advocate, our role is really to listen to kids, listen to what they have to say about their experiences, elevate their voices and walk alongside them in taking those voices to influence policy making, systems change and practice. So it's from that vantage point that I can talk a little bit today about the out-of-home care system and the lack of progress under Target 12 to reduce overrepresentation of Aboriginal and Torres Strait Islander kids in care. I can also share a little bit about what we've heard from First Nations kids about their experiences and what they think needs to change. And I guess in summary, the Create's position in relation to the inquiry, I can summarise across a number of points really, and that is if Australian governments are serious about children's safety and wellbeing and serious about closing the gap, they need to do a bunch of things. Those things, in Create's view, are listen to community and the community-controlled sector. The knowledge is there. There have been numerous Aboriginal-led system reviews over many years that very clearly map a way forward to reduce overrepresentation. They simply haven't been resourced and implemented. Invest in self-determination because it's not a luxury, it's a right. And as such, it should be enacted across all legislation, policy frameworks, practice and commissioning models. Invest in early intervention, including family support services and family preservation efforts. This will reduce entry to care and it will reduce the grief of separation for children, families and community. Implement safe and supported. The first Aboriginal and Torres Strait Islander action plan has been expressly designed to reduce overrepresentation. The actions are there, it just needs to be supported. Act quickly. This is urgent. So in the last Family Matters report, there's some very alarming projections around expected increases to the care population for Aboriginal and Torres Strait Islander children, an increase by 38% over 10 years. And once in care, kids are not necessarily safer. We know this from substantiations of abuse in care. We hear it directly from young people. And, we know that many children experience adversity and trauma while in care, and that the care experience is associated with poorer life outcomes. And deep disruption to culture and identity. So, we kind of urge the listening to kids. They have a lot to say about their safety, their wellbeing and their cultural rights, and address the social drivers that are conspiring to interact and drive contact with child protection. Things like trauma, poverty, which is often confused for neglect in a child protection context, housing instability, family violence, disability needs and mental health and substance. Child protection reforms in isolation are not going to address the structural conditions that are resulting in child removals. So that's a bit about the things that I can talk about in a little bit more depth. And yeah, thanks for having me here today.
Great, thank you very much. I might go to the Deputy Chair first.
Thank you, Chair. My first question kind of is the same question I had for the last week's, which is what are the things that we aren't capturing right now?
Yeah.
Yeah.
I had a little bit of a think about that in the lead up to here. I guess, in essence around targets and what's reported on, a few things I'd say about data and evidence generally and the principles that should underpin the way that we orient to them in this context is honouring Aboriginal and Torres Strait Islander knowledge and evidence, commitments around data sovereignty and a kind of Aboriginal-led, evaluation of closing the gap. I think even just the construct of the overrepresentation or the number of Aboriginal children in care needs close, kind of observation and challenge. So, Family Matters points out every year that there's some real gaps in counting rules around how governments report on the number of Aboriginal children in care, or the number of children in care generally, and the exclusion of permanent care orders is making invisible a whole cohort of children, and essentially it's masking the true state of overrepresentation. And that matters because Aboriginal and Torres Strait Islander children are 10.8 times more likely to be placed on long-term orders like guardianship and custody orders, third-party parental responsibility orders than non-Indigenous children. I think in 2021-22, 73% of Aboriginal children in out-of-home care were on those long-term orders. So I think that is a critical issue, and kind of transparency around the true kind of state of the rates is really important. The kind of functional processes driving overrepresentation are really around entry to care. We know that Aboriginal and Torres Strait Islander children are 11 times more likely to enter care than non-Indigenous children. They spend longer in care. The length of time on average is longer, which is another driver of overrepresentation, and there are really low reunification rates in general. So those are some of the things in terms of, and I think another driver of those rates is a culture of surveillance that leads to notifications, and also commissioners and community have talked about some of the child protection practice frameworks, assessment tools and models, having a kind of structural bias and not giving full account to kinship systems and collectivist approaches to raising kids. So, sorry, that doesn't really answer the question. The question, there's lots that needs...
I feel like you definitely had some parts.
I've got more to say.
More than you want to say.
Yeah, there is.
But I might just interrupt for a second because I know that I'm probably going to get the wrap up in a second to share the call. What's the basis for not including kids on permanent care or long-term care orders?
I believe it was a change a few years back in the reporting rules. I'm not sure the kind of policy context that led to that, but it's something that's called out year on year in the Family Matters report, and that's why the numbers presented in Family Matters don't match the numbers from the Australian Institute for Health and Welfare.
And are there any states that are kind of faring better than other states? I think they've probably all got a bit of a poor child protection notification removal rate.
Yeah.
Victoria is certainly leading the charge.
Yeah. I mean, some states are doing better in different areas. So I think where there have been steps towards delegated authority models, like the transfer of authority, we know helps. It helps increase family preservation and reunification.
Yeah.
We know that steps like that work.
So I think I feel like this is probably old information, but last time I was chatting to the Victorian Aboriginal Child Care Agency about this, it's like they were 50% more likely to be returned to their home if VACA had the guardianship responsibilities for the child.
Yeah.
Pretty big, actually.
Yeah, it's huge. I think it points to it as, a real kind of solution to be rolled out nationally. So, yeah, I think, that's a major part of enacting self-determination in the child protection context.
Yeah. So the reunification stuff, is there any kind of standout examples for like the early intervention work, family preservation work?
Well, in Victoria, there was implemented a couple of years back the Aboriginal Family Preservation and Reunification Model. So I do believe that that's been delivering good outcomes. I think it's evaluated. That was part of the stand-up of the program, was to design an evaluation to roll out with it. So I think so. But overall, it's like there's very little funding in the front part of the system. It's 15% of all child protection system funding, and 6% of child protection funding goes to ACOs. So for 41%, of kids in care that are Aboriginal. So yeah, the balance is off.
Yep.
with the funding. And I think like targets, back to the targets, some targets around investment in early intervention and investment in ACOs, I think would be really helpful. And then I think there's other parts that could be, or there's other things that could be looked at, like unborn reports, which are highly kind of connected to entries to care, and yeah, it can be a vulnerable kind of point where wraparound support would divert that entry.
Yeah. All right, and my last question before I need to share the call, and I don't know what I suppose kind of what conversations you're able to have with kids in particular and out of care. Or have had some contact with the care system.
Yeah.
Have they shared any views about what they would like measured or kind of seen in what it is that we focus on? I know it feels like a very kind of policy question to ask, but I'm interested in kind of if they were to have a say on what we count, what would they say?
Okay, well, I'll start with what they say in general, and then maybe we can draw some conclusions around what they might like measured. What we often hear from young people is that they want to go home, you know, they want to be reunified with family. If they can't go home, they want choice about where they live. They want to live with Aboriginal carers. They want to choose to be able to live with siblings. And they almost always want more contact with family and community. They want culturally safe, culturally informed programs. They're yearning for it. And we hear a lot about you know, a very deep yearning for culture and a real sense of loss and disorientation when they don't feel connected to culture. They often don't have cultural plans, and when they do, they're often not meaningful. I think just in general, they want their culture respected, they want choice, they want the people that matter to them and their community involved in decision making around their lives. So I guess, you know, cultural plans I think are measured among the indicators, but doesn't give a true reflection necessarily of how meaningful they are or the extent to which they truly enact the young person's wishes. I think in general, asking young people, like, you know, measures around what young people say around their cultural connection or their influence over decision making can be really helpful. Often it's a missing piece, or the rhetoric is there but it doesn't happen in practice.
Yeah, I think there's lots of assumptions we could draw about what the measures of success would look like for children and young people, but I'll share the call.
Thank you, Deputy Chair. Senator Little.
I've just got one question. Thank you for appearing today. The work that you do, where does your funding come from? Is it a Commonwealth funded program or a mismatch over them?
We receive funding from all state and territory governments. We don't receive core funding from the Commonwealth. We have been contracted to do projects from time to time, but nothing in recent times.
Right, okay.
Yeah, and a tiny little bit of philanthropic, but it is mainly state government funding.
So you call yourself national, but where do you operate?
All states and territories.
Right.
We have a little team in every jurisdiction and a national team that's remote.
Okay, thank you.
Excellent. I don't have any questions. You've answered all of my questions, thankfully.
Great.
Which Senator Stewart asked. So that's
Great minds.
that concludes that concludes the committee hearings for today. So I want to thank all of the witnesses that gave evidence in the committee today. I'd like to reiterate that if any of the matters discussed today cause you to feel distressed, the committee encourage you to seek support, and you can contact Lifeline Australia on 13 11 14 or 13 Yarn on 139276. For witnesses who have taken questions on notice, please be reminded that answers are due to the Secretariat within 2 weeks, which is Wednesday, March 5th, 2025. However, please liaise with the Secretariat if you need additional time. Thank you to Hansard and Broadcasting, and the committee stands adjourned. you.